council member from Brooklyn. And I'm also going to ask our committee counsel, Zé Emmanuel Hailu, to offer the affirmation of the commissioner before we continue with Q&A.
Do you affirm to tell the truth, the whole truth, and nothing but the truth in your testimony before this committee, and to respond honestly to council member questions?
I do.
Thank you. Maybe I can ask one of the sergeants to close the back door while that noise is. Commissioner, most of the stats that I have on youth use of e-cigarettes are national, and I'm wondering if you have statistics or even estimates on the number of teenagers in New York City who are using vaping products.
So, council member, currently we have, sorry, there's a little bit of feedback. 17% of youth have reported starting, 17% of youth use e-cigarettes, and that equates to roughly 45,000 youth who report using e-cigarettes in the last 30 days. And of that number, 2/3 report starting with flavors.
And what is the source of that data?
That source is our YRBS data. YRBS is the youth behavior risk surveillance that we do with New York City public high school students.
So does that capture middle school students?
That is a separate survey. This only captures 9th grade and up, and it only captures youth that are enrolled in school.
Sorry about the feedback. I'm just going to pause a second and see if we can track down the source. There might be an open mic. You think there's an open mic? Well, just the feedback. This was an Amazon hearing prior to this, so I'm wondering if there's like an Amazon echo that's listening in on us right now. Alexa, please stop making noise.
But
Maybe kill that mic and try one of the others at that table? I don't know.
is that better?
That sounds good.
That sounds better, right?
Okay. So I think I was asking you whether middle school students are captured in your data on teen vaping.
We don't have data for middle school vaping rates. We only have data for high school. And we know that of that 45,000 that I mentioned earlier, amongst the youth that are reporting usage, 27% of them are white, Latino at 19.5, and Black at 10.7, and Asian at 10.9. So it's across all racial groups that kids are really taking advantage, if you will, of flavors and unfortunately getting hooked on nicotine.
Can you say anything about trends? Do you have prior year data?
No, unfortunately, if you look at that graph that we had up somewhere, I don't know where it went, our data only begins from 2015.
It did appear to go up at least for the 2 years that you had data, but it did appear to rise at least for the 2 years that you had data, although obviously we need more time to look at the trends.
And the thing about that YRBS data, it's conducted every other year. It's not like we have yearly data to look at.
Right. Look, if 45,000 young New Yorkers are doing anything that is harmful to their health, that to me is a crisis. The number is going to be greater if you consider middle school students, and we know sadly that there are middle schoolers who are vaping. Your stats on the demographic distribution tells us that no community in the city is immune.
Exactly.
And most germane to this hearing, if 2/3 of those users are entering this addiction via a flavored e-cigarette, that just tells us what a serious factor in teen adoption these flavors are, which confirms much of our suspicions.
And Mr. Chair, we can follow up with middle school data.
Okay. In terms of the sale of these products, do we know how many actively licensed retailers there are?
So currently, with the recent legislation that was passed, we know that we have 2,934 retailers that have been licensed.
Is that number capped for e-cigarettes the way it is for tobacco?
So the way that the legislation passed is that that is capped, and then over time, looking to reduce the density. And I have my colleague from DCA that can answer any more detailed questions on that.
And we're going to ask him to do the affirmation as well.
Do you affirm to tell the truth, the whole truth, and nothing but the truth in your testimony before this committee, and to respond honestly to council member questions?
I do. And for the record, my name is Casey Adams, Director of City Legislative Affairs at the New York City Department of Consumer Affairs. So, Councilmember, yes, the number of ECRD licenses is capped by the same formula as the tobacco retail dealer license, which is 50% of the number of licenses that were issued on a date certain, and that date certain occurred in February, and it was after a period of applications. So, as the commissioner mentioned, we now have 2,934 actively licensed ECRD businesses. That number is capped. There are situations where a license can move between businesses if a business is sold and bought and was in good standing, but the number should not go up. And our caps, I'm happy to provide them. They're actually up online, and it will tell you for each community district the number of licensed businesses and the cap. And in each district, it should be about 50% of the cap at this point because there hasn't been a lot of attrition.
Okay. I'm correct that the minimum age to purchase any vaping products is 21, correct?
Yes.
So how do we explain the fact that 45,000 high school students are vaping in a city where sale to minors is prohibited?
I can speak to the sales side of that equation. We do very vigorous enforcement. We have a dedicated tobacco and ECRD squad. There are both city and state laws and rules at play here. So we have a unit that goes out and conducts sale to minor or sale to youth, in the case of 21, inspections. And that will involve an actual youth or minor who goes in to attempt to make a sale. So I don't have the sale to minor data, violation data with me right now. I'm happy to provide that to you after the hearing.
And Councilmember, just to be complete, the data that we are reporting on is as of 2017, and it just reports on usage. We don't ask where it was purchased.
Right. We know of anecdotes, however, of young people who are able to purchase these products in New York City stores.
Yes.
Sometimes it happens by passing a couple bucks to the person behind the cash register. Sometimes it happens because they just don't bother to ask for ID. So we do need to ramp up enforcement for the sake of traditional tobacco products as well. And while we're at it, for alcohol and other products which we don't want in the hands of young people. While advocating for strict enforcement, I'm also a realist, and I know that even with the most stringent enforcement, there could be an adult who purchases and passes it to young people. I know that's illegal, but that's very difficult to enforce against. And I think we need to be realistic about the prospects of, say, a ban on sale of flavored e-cigarettes only to minors simply not working, because either there would be some sale direct to minors or they would get it via people 21 and older. And that's led us to this move just to get the flavors out of the stores so that we don't have to worry about them finding their way into the hands of young people.
Absolutely.
Can you tell us about the fines and sanctions now for stores that do sell to minors?
Yes, the penalties for violations of the tobacco laws vary widely. They go from as low as $500 to as high as $5,000, and typically that will escalate based on the recidivist status of the violator. So the more violations that you get within a certain year period, the higher your penalties will be. And as well, violations like sale to minor can impact a business's ability to hold on to a license, which is and revocation is quite a severe penalty in a legal situation where the cap is only going down.
But how often is that penalty actually applied? How often are we revoking licenses?
As I said, revoking is a very extreme remedy, so it's not very common. I don't have the number on that for you. I'm happy to get it for you. And as well, as you noted, flavored cigarettes are illegal in New York City, and we do have data on the number of violations that we issue for sale of flavored tobacco because people continue to do it. We continue to enforce against it, and we take it very seriously.
Do you have a number on fines short of revocation?
I don't, but I'm happy to get it for you.
Any enforcement system is only as good as
Yes.
the penalties which are placed on people who violate it.
Yeah.
So this is a very important question.
It is, and I want to note that the penalties in this area are some of the highest authorized in DCA's law. So typically our fines do not go up to $5,000, but they do in this case. And we, as I said, we have a dedicated unit. We report to the state on tobacco enforcement as part of our grant process because we receive money for the state for tobacco enforcement, which we submit to the state, and I'm happy to provide those reports as well, which will tell you about how many checks we do. Typically, we try and do in the range of 10,000 sale to minor checks in a year for the purposes of the grant. But that's not the whole picture because there's also sale to adult violations that happen with flavored tobacco, for instance. But I'm happy to provide the reports that we submit to the state, which will give you a more complete picture.
Yes, please. Commissioner, as I mentioned in my opening statement, I view the crisis of teen consumption of e-cigarettes as being a different matter from the question of adult smokers transitioning off tobacco to e-cigarettes, understanding that even in that case, science hasn't really determined the effectiveness of that as a smoking cessation strategy, and that there's still significant negative health effects of nicotine consumption and some of the other chemicals in e-cigarettes. But generally, the medical profession is comfortable with Nicorette gum and other brands of nicotine gum and the patch. I think there's probably questions about their effectiveness, but those are generally accepted as part of the toolkit for people who want to get off traditional cigarettes. So is it not fair to put tobacco-flavored e-cigarettes into the same category?
You know, that's a very important question because the industry would like us to believe that e-cigarettes are a way towards cessation. And the reality is that the Surgeon General's report in 2016 cites that the evidence for that is very weak. We do support FDA-approved cessation products, either by prescription or over the counter, mainly because they have been studied. We have confidence about the degree to which the nicotine is released. I think one of the major concerns about e-cigarettes is that we have no clear way of knowing that every single puff will deliver the same concentration of nicotine. And while that science in terms of its effectiveness as a cessation product is weak, what we do have is strong evidence of how it is that e-cigarettes, and to the degree that they utilize flavors, to the degree that they target youth in their marketing, has been effective in increasing the percentage of youth that are exposed to nicotine.
All of us know people, I certainly do, who are adults who have given up cigarettes and transitioned to e-cigarettes, understanding that anecdotes don't equal data. One thing I've observed among some of my friends is because it's so easy to smoke e-cigarettes, because you can do it indoors easily without bothering the person next to you, that often they end up smoking a lot more of the e-cigarettes than they did of the combustible devices, and are probably getting more nicotine into their body. Now, they're not getting some of the other chemicals that you get with traditional cigarettes, so that's good. But there might be an unintended consequence of the transition from cigarettes to e-cigarettes of actually getting more nicotine because it's just easier to smoke. And I think you mentioned in your opening statement that one pod is equivalent to the amount of nicotine in a whole pack of cigarettes. Is that not right?
That's exactly right. So there are 59 grams of nicotine in a jewel pod, which is a whole pack of cigarettes worth of nicotine and twice the amount that is approved in Europe. And so, part of the issue here is that when someone is smoking a pack of cigarettes, they have the number of cigarettes that they can say, whoa, I need to cut back because look at all the cigarettes I'm smoking. They don't have that option when they're puffing on, a jump drive, right? They just keep doing it. It's part of the addictive process. And so that's why I would really like to see these companies provide rigorous science. I would like for them to go through the FDA process and get certified as cessation devices. I think there's no question that nicotine is addictive and that once you start smoking, it's hard to stop. I've never been a smoker, but I certainly understand the challenges of trying to get off nicotine, and so I think that we can well serve the public by giving them more options that have gone through the FDA process.
The health impact of nicotine, which nobody's claiming nicotine is good for you. It's a highly addictive substance. It's not an easy addiction to kick. This isn't like caffeine where you have a couple days of a headache and then you're clear. This is a very difficult addiction to kick. And we know kids, I know kids who are caught in the grips of this addiction, and so they keep sneaking to the bathroom to smoke. Sometimes they resort to smoking in classrooms, hidden behind a book or something, because their body just has a craving. I believe there's research on the negative impact of nicotine on people who have heart issues. I think it's pretty well established that in pregnancy, nicotine consumption is very bad. I think, or at least I've read, that there are concerns about the impact of nicotine on adolescent brains developing, with possible impact on memory and attention. Can you say anything about what we know about the health impact of nicotine?
So, Councilmember, I think you highlighted some of the main concerns that there are with nicotine. I think the point to focus on with youth is that it also can affect their educational progress by affecting memory, concentration, and the like. But one of the things that we haven't focused on is that cessation products, there's not enough science to really say that in youth they are effective in helping them kick the addiction of nicotine from e-cigarettes. So that's yet another reason why it's so important to focus on the fact that big tobacco is utilizing flavors as a gateway to create a whole new generation of smokers, and that's why this proposed bill is so important to ensure that we cut that pipeline off.
Do we know anything about the frequency with which someone starts on an e-cigarette and then goes to combustible cigarettes?
So I don't think that we have enough data to say with any kind of certainty, in a 1 year's time or an X period of time. What we do know is that a not insignificant percentage of individuals report having started with e-cigs and then transitioning to cigarettes.
some advocates for the industry would say that young people are starting on e-cigarettes instead of tobacco and would never get to tobacco. Do you have any comments on the validity of that argument?
I think that there's a lot of things that industry would want us to believe that are not based in science, and what we know by looking at the data that we have is that we as a city are losing ground in terms of ensuring that our youth are not addicted to nicotine and don't end up being lifelong smokers, because once you start, and especially if you start at a very young age, it's incredibly difficult to stop. And so as the public health authority, our responsibility is to draw attention to this and take measures that will help to save lives.
I think what your chart shows is that there was thankfully a decline in youth smoking for years, and that it's roughly plateaued in the era of the e-cigarette rise, or at least during the last couple of years when we have data. Am I reading that chart right?
What the dark lines show is cigarette use, cigar use, smokeless tobacco use, and it demonstrates that with measures that were taken, for example, taxing cigarettes, increasing the floor price, introducing Tobacco 21, all of those measures were effective. But in the lighter color, which is more challenging to see, we see that e-cigarettes have been able to circumvent all of those measures, and that's why it's so important for us to focus in on not only e-cigarettes, but the issue of flavors as gateways to smoking.
Councilman Cabrera, who's the lead sponsor of Intro 1362, I believe. Sorry, that's 1345, which you addressed in your opening statement. One of the concerns that I know we're going to hear today related to a ban on menthol cigarettes, and now I'm talking about tobacco, traditional tobacco cigarettes, is that it has a disparate impact on communities of color in New York City, and that therefore there's a concern about unintended law enforcement consequences related to such a ban on menthol. And I'd like to give you why you're here, because you won't be here, you won't be able to respond when advocates speak on this. I'd like to give you a chance to address that concern.
Thank you. So one of the things that we are incredibly concerned about is the fact that tobacco, big tobacco, has been able to target communities of color, target youth in getting them to start smoking. And we talk about the percentage of Black and Latino adults that are current menthol smokers. 85% of African American adults do smoke menthol, 64% of Latinos do smoke menthols, but what doesn't get enough attention is the fact that 57% of women who smoke also smoke menthols. So this is yet another opportunity, another way in which industry would like us to have the conversation about how we are disproportionately targeting communities of color in terms of reducing the number of smokers. But I think the real issue here is how tobacco, big tobacco, has gone unchecked, targeting communities, youth, and women, getting them hooked on cigarettes.
Sheriff, it's great to have your perspective. I'm going to ask you to pause so that Zé Emanuel can do the affirmation, and then we look forward to hearing from you.
Certainly.
Do you affirm to tell the truth, the whole truth, and nothing but the truth in your testimony before this committee, and to respond honestly to council member questions?
I do.
And please state your name for the record.
Joseph Aceto, Sheriff for the City of New York. So thank you for having us here today. Your concern is very valid, and I just wanted to go over that this legislation doesn't criminalize these issues. What is criminal in these issues is the taxation portion. And just like any other offense in the city, if there's taxes that are due at a certain point in time, if you don't pay them, there will be a criminal implication. So the ban on e-cigarettes has nothing to do, there's no criminal impact on the ban on e-cigarettes. There isn't now, and there won't be after the legislation would pass. The issue is menthol cigarettes If they're sold in the city after this legislation, conceivably it would be a tax crime because the taxes were not paid on it. And the focus of the Sheriff's Department's investigations have not been the small street-level offense. That's almost like the horse is already out of the barn. That is not going to stop the problem. The Sheriff's Department focuses in large trafficking networks. In fact, last week we did the largest seizure and arrest of any case that we worked on, and it involved a $30 million tax fraud case. So that's the criminal focus of law enforcement when it comes to the enforcement of cigarettes, the large trafficking networks. On the lower end, when we do our regulatory inspections in businesses and wholesalers, there is a civil penalty which is enacted first, and that's for the lower level offenses of having untaxed product. And then once you reach felony level, that's when we start talking about criminal offenses, but that's a very high threshold. So walking around with a carton of cigarettes or a pack of cigarettes of menthol cigarettes will not be a crime. The sale of 50 cartons of more of untaxed cigarettes is a crime.
So just to clarify, and this would apply to e-cigarettes as well, it is the sale of these products which would be illegal, but the possession or consumption of them would not be.
E-cigarettes now and after the legislation have no tax impact. So there's no investigation on the tax component of what, there's no offense for the sale of e-cigarettes. That's handled administratively by the Consumer Affairs. The sheriff's concern is the product that has to be taxed, which is other tobacco products and cigarettes. And it would be the untaxed sales is where we would have a concern.
So you wanted to add something? Go ahead.
But your statement is correct. It's just the sale. It's not related to the possession or consumption.
So if a young person today, let's say if a 19-year-old who's not a minor but is not allowed to purchase an e-cigarette were found with an e-cigarette on their person or smoking an e-cigarette,
that's not a crime.
that's not a crime.
That's not
Would there even be a civil summons or any?
There's not a civil summons for that unless you're violating some smoking regulation of the city of New York.
Right. I mean, there are places in the city where it's illegal to smoke any product, electronic or tobacco. But if a young person was consuming an e-cigarette in a place where it's legal for someone to smoke, they would not face any sanctions.
They would not face any sanctions, and that's true if somebody's smoking a menthol cigarette if this legislation passed. If they were smoking a menthol cigarette in a place where they are allowed to smoke, there's no criminal impact.
Okay. Thank you, Sheriff and Commissioner. My colleague, Councilmember Powers, has some questions.
Thank you. Thank you for doing this hearing. Thank you, everybody, for being here. This discussion around the legislation and this entire discussion really is predicated on the discussion around the harm that's presented by a flavored cigarette or flavored electronic cigarette. So I want to ask some follow-up questions on that. The first thing is you had a point you had made earlier that the Surgeon General said there was weak evidence related to smoking cessation. And I wanted to ask, was it weak that it doesn't serve as a smoking cessation tool or that it's being used that way?
Weak specific to the e-cigarette component, not cessation in general. Cessation in general is something that we support, but in terms of using e-cigarettes.
But my question is did the Surgeon General find there was weak evidence that electronic cigarettes were not being used as a smoking cessation device, or were not serving the purpose of being a smoking cessation device?
The studies were around the effectiveness, and we can get back to you on the specifics of, there was some weak in terms of, yes, it might be helpful, there was some weak, and it doesn't make a difference. I think the main point is that there have yet not been rigorous studies done to demonstrate definitively to the degree that other cessation products have been that these are helpful.
Okay. And is the concern from the Department of Health around it being a gateway to traditional tobacco products or it being harmful in itself?
The combustion of e-cigarettes does liberate certain chemicals that have been demonstrated to cause harms. I think we need more science to sort of illustrate what that dosage might be. The concern is more so, or in addition, the degree to which then young people, because of the effects of nicotine on a young developing brain, would be more likely to remain addicted.
Okay, and can you tell us which chemicals you feel like are the most harmful here in terms of electronic cigarettes?
Yes, but I would have to look at my notes to
Sure, no problem.
tell you the exact ones. Sorry, what page is that? 3. So, yes, formaldehyde, benzene, diacetyl from the flavoring, and heavy metals, including nickel, tin, and lead.
Got it. And the concern, can you tell us, state the concerns with those chemicals?
The cancer-causing chemicals would be formaldehyde and benzene, and then the diacetyl has been linked to lung disease, and then heavy metals may affect other organs in the body, for example, kidneys.
Okay, so it sounds like you have questions about the harm that's presented today in itself, in addition to the ability to serve as a gateway to a traditional smoking product.
We
Is
would
that
like
fair?
to see more studies to demonstrate the degree to which these are causing harms in long. Part of this is, how much are people vaping, how long, and then how do you correlate that effect with chemicals that have been demonstrated to be harmful to health?
Okay, and those chemicals, I presume, are in all electronic cigarette products, and the flavored and the unflavored?
So part of the challenge, and I have a staff member here who can introduce herself, part of the challenge is that since these aren't regulated by the FDA, it's hard to know exactly what's in what, right? And so that's yet another reason why having them be regulated by the FDA would be useful. Do you want to add to that?
Yeah, I think you have to be sworn in as well.
Hi.
Do you affirm to tell the truth, the whole truth, and nothing but the truth in your testimony before this committee, and to respond honestly to council member questions?
I do. I'm Kim Kessler. I'm the Assistant Commissioner for the Bureau of Chronic Disease Prevention and Tobacco Control. I would just echo what the Commissioner said. We don't know enough about what's in all of these products, and the long-term health effects of them are unknown, but we do know that many of them can release the types of components that she spoke to.
And can you, the FDA has not approved these products or regulates them. Can you tell us why that's the case?
There just aren't strong control. There has not been a strong process around this yet. So we, as the Commissioner spoke about, we don't yet have, the FDA has not yet approved any of these products for cessation, unlike other nicotine replacement therapy, which there is evidence base can help people to quit. And in general, and the regulatory regime around e-cigarettes is still being developed, which is very much in the news and the FDA has been speaking about recently.
So I would add that this is one of those examples where, for reasons that escape me, these big companies have been able to circumvent the processes at the federal level, right, and still call themselves cessation devices without having gone through the FDA process.
And did the FDA regulate smoking cessation products normally? Is that correct?
Yes.
And these products have not been regulated by the FDA, or approved, I should say, by the FDA as smoking cessation products?
Typically, smoking cessation products are approved and they submit scientific evidence to establish that they bring a cessation benefit. And there are FDA-approved cessation products, and e-cigarettes are not among them. They have not completed that regulatory hurdle.
Okay. And then if this ban on the flavors passed, there would be a ban, I guess, in retail in New York City, but you could still access products online. Is that correct?
I believe so, yes. It
Okay.
would be on retail in New York City.
And what regulations would be in place beyond, we have a regime of regulations around age and location with the pharmacies and others. So those would be, so flavors would be banned. These smoking products would be limited in terms of location and age, I guess. What would be the ability to like the chair's point around access by folks who are below the regulated age or the allowable age today? What would become their ability to get products via online or through the through those who create the products, through other online places? Like, what would be to get if you wanted a flavored product after this and you were 17 or you were 22, what would be in place?
So I think that those would be remaining questions that we would be happy to work with council on to figure out ways in which we could limit the degree to which other avenues of getting these products would hinder our ultimate goal of keeping New York City youth from starting on e-cigarettes or any form of tobacco.
Okay. I may have follow-up questions, but I'll hand it back to the chair. Thank you.
Thank you. Just to clarify on the federal front, there was a dramatic announcement a few months ago that the FDA, I think, was putting the industry on warning, essentially, that if they didn't find their own ways to reduce youth consumption of e-cigarettes, that there would be regulatory action. But am I to understand that they've ultimately pulled back from acting? What is the status of federal action on this?
So right now, and I'll ask him to come back up, right now there hasn't been any action, and you're right, there was big fanfare. Part of the challenge was that the FDA was in essence leaving it to industry to regulate themselves. And we would hope for more affirmative action, and that's why we're very excited about supporting the bills that are before us. I don't know, Kim, if you want to add anything to that.
So the FDA's been updating their compliance procedures, but at this point they're voluntary. So they are issuing guidance to industry about where these products should be available, but they're voluntary. So they wouldn't go as far as what the council's proposing here.
And at the state level, I know that the governor has made some strong statements about wanting to confront this crisis. I believe that's the case. I'm not sure if any specific policies have been proposed, but am I right that at the moment there is no state regulation of the sale of e-cigarette products?
That's correct.
Okay. All right. Well, we like it when New York City's in the lead, and we like to set the example for other parts of the state and the country. And we thank you, Commissioner, for your strong support and for your sharing your scientific knowledge on this topic, and look forward to working with you on this issue.
Thank you, Mr.
Thank
Chair.
you.
We look forward to that.
And we're going to go to our next panel, which is Matthew Myers from the Campaign for Tobacco-Free Kids. Lorraine Braithwaite-Hart from the NAACP, New York. Bill Sherman from the American Cancer Society. Michael Seelbach from the American Lung Association. Robin Vitale from the American Heart Association. That is a high-powered panel if there ever was one. Mr. Myers, since you have traveled the farthest, would you like to start us off? Can you make sure your microphone, there's a button there, is on?
Is that better? Got it. It's a real pleasure to be here, and so I very much appreciate that. My name is Matthew Myers. I'm the president of the Campaign for Tobacco-Free Kids, which is the largest non-governmental organization in the world, actually, devoted to public policy advocacy around this issue. It's a privilege to be here because New York City and this city council has led the way on so many important issues over the years that this hearing couldn't be more appropriate. And it's also important to understand that the two bills you are considering today fill what is one of the most important set of gaps in protection of our young people and, frankly, African Americans in the country today. It's important to put it in context. And the context is, in terms of cigarette smoking in this country, despite all the progress we've made, the poorest, most vulnerable of our citizens are most at risk. The second thing that's important to realize is, as you heard previously, we have made historic progress in reducing youth tobacco use across the board, but flavored e-cigarettes, particularly Juul, threaten to undo that progress in an extraordinary manner. Your two proposals will do more to both protect public health and finally begin to attack a health disparity caused by the targeting of the African American community that is long overdue. Let me just talk about a few of the issues. You have my full testimony, including copies of advertisements there. Let me talk about a few issues. First, let me address your bill with regard to flavored e-cigarettes. Extraordinarily important. Even more important than you just heard, because the data you just heard from New York City was in 2017. Between 2017 and 2018, we had a crisis epidemic of skyrocketing e-cigarette use in this country that changed all of those figures, and it's extraordinarily important to realize. The national version of the National Youth Tobacco Survey that you just heard about showed that there was a 78% increase in e-cigarette use since the New York City study was done across the nation, and a 48% increase among middle school students. So that 45,000 you heard, that's fiction. That number is much higher. Similarly, the prestigious Monitoring the Future study done by the University of Michigan that has been done every year for the last 43 years found that e-cigarette use among teenagers rose at a rate more rapid than they had ever seen for any drug in the last 43 years. So the numbers you heard are the tip of the iceberg, and it's much worse. The New York State NYTS for 2018 also shows that between 2014 and 2018, e-cigarette use increased by 160% statewide. You should know that the 17% figure you heard in New York City for 2017 was already above the national average, so that you have to assume that what you're dealing with in New York is much worse than what you heard. I'd like to make 4 key points about it because they relate to the questions that you asked. First, are these kids just experimenting and not becoming addicted? That's one of the arguments you're going to hear. The number is now irrefutable. The National Youth Tobacco Survey showed that 27% of the kids using these products today use them on 20 days or more. That's a level of addiction as severe as we see among cigarette smoking. Any argument that these kids were just moving on has been blown away by the new 2018 data. Second, these products are not replacing e-cigarettes. There's now about 10 studies that show that the kids who are using these products are the kids who would not have smoked. That's why the chart you saw here is, in fact, emblematic of what we've been seeing. It is also the conclusion of both the Surgeon General and the Commissioner of the Food and Drug Administration that that is the case. 3, you asked about what does it mean for future cigarette use. The Surgeon General, the National Academy of Sciences, and the Food and Drug Administration have all concluded that the studies show clearly now that kids who use e-cigarettes are more likely to go on to use cigarette smoking. Do we know the long-term impact of that? No, but we do know is that study after study shows that e-cigarette use leads to greater cigarette use. And 4, the other question that you asked pointedly, and that is while there are a lot of anecdotes and there are a lot of individuals who clearly have quit smoking using e-cigarettes, the scientific data is inadequate to conclude that it is an effective tool for helping smokers quit. Most recently, the National Academy of Sciences looked at the issue and found that it was limited and inconclusive. Since that time, there have been 3 additional studies in the United States that have raised questions about the efficacy of that. In the absence of FDA reviewing those products, the answer is we simply don't know, and we have reason to be concerned. Let me move on to menthol cigarettes, if I can quickly, let me first go back to the issue of flavors. It is flavors that is driving this issue. 8 out of 10 kids who use e-cigarettes say not only that they use flavored e-cigarettes, but they use them because of the flavors. If we want to stop the scourge of e-cigarette use among kids, we have to get rid of the flavors. And we have to understand These flavors haven't been introduced with scientific evidence in advance that they help individual smokers quit. There are literally over 15,000 flavors available in e-cigarette use today. They're introduced because they think they'll appeal to a market, and we know who that market is. Now let me do menthol cigarettes, because I don't think there is any single action that one could take that would help reduce the death and disease of tobacco among New York citizens more rapidly than the action that is being proposed with regard to menthol cigarettes. And this is one of those rare bills that is both a public health issue and a matter of social justice. You correctly raise the issue. What we have seen is for decades, the tobacco industry has targeted our youth and the African American community like a laser beam. And the consequences to the community have been devastating. Make no mistake, there is nothing inevitable that African Americans will smoke menthol cigarettes. If you actually look at the data, and I've got a chart in my testimony for you, in the early 1950s, only 5% of African Americans who smoked menthol. It was exactly at that time that the tobacco industry documents show that they saw that as an opportunity and targeted the community. Between the early 1950s and 1968, that number went from 5 to 14%. Lorillard and the other big tobacco companies said there is an enormous opportunity here. They have succeeded in taking that 14% and moving it up to over 80%. The consequences for the community are unbelievably devastating. African Americans suffer from lung cancer rates at higher than national average, cardiovascular disease rates at higher than the national average, life expectancy rates at lower than the national average. Cigarette smoking is one of the major causes of health disparities and health inequity in this country, and it is because the tobacco industry has targeted this community, not because of anything else related to the community. There's also a scientific explanation for it. The data now shows clearly that menthol increases the intensity of the addiction and therefore makes it harder to quit. So data in the African American community shows that African American smokers try to quit at rates that are actually higher than Caucasians. But because of the power of menthol, they succeed at lower rates. And if you want to talk about kids, you can't talk about kids and menthol in the same breath without realizing the impact. Over 50% of all kids who smoke in this country use menthol. Among African Americans, the figure is 70%. It is the gateway to long-term addiction and death and disease from tobacco. Eliminating menthol cigarettes is probably the single most effective thing that one can do to reduce health disparities among that community and to assist that community to make the smart decisions the right way. New York City is the perfect place to do it because, as you heard, you do not criminalize, you do not penalize possession of the product. This is an action that can be taken without regard to any of the so-called unintended consequences that we have seen before. This issue was raised in both San Francisco and Oakland that considered similar legislation and has passed similar legislation. And as you heard from your sheriff, the police in those cases said very clearly, given our laws and given how we implement those laws, we don't see any likelihood that that will result in, quote, unintended law enforcement issues with regard to that community, and we haven't seen any yet. So let me say to you, you are considering two bills that have the potential to reverse the greatest threat we have seen to our long-term progress in reducing tobacco use among our kids, into tackling one of the most serious public health problems facing the African American community today. We look forward to working with you to help pass this bill, and equally important, in the implementation phase of that bill to make sure that the consequences you seek are achieved. Thank you.
Thank you, Mr. Myers. Thank you for coming all the way up from DC and for your leadership in this important campaign. Please take it away.
Okay. Good afternoon, Chairman Levine and other members of the committee. First, I want to thank you for the opportunity to testify before you this afternoon in strong support of the Intro 1345, an ordinance that would restrict the sale of menthol, mint, and wintergreen flavored tobacco products to tobacco bars in New York City. In 2009, when the council first restricted the sale of flavored tobacco products in New York City, it included an exemption for menthol flavored products. As you know, the tobacco industry has long targeted its marketing in menthol products to youth, especially African American youth in the city, and more broadly to African Americans overall, with devastating consequences. The time has come to end this blight for the New York City Council to protect all of our children from these insidious products. My name is Lorraine Brathwaite Hart. I am the health chairman for the New York State NAACP, and I am speaking today on behalf of Dr. Hazel N. Dukes, president of the New York State NAACP, and a member of the NAACP National Board of Directors. The mission of the NAACP is to ensure that political, educational, social, and economic equality of rights for all persons and to eliminate race-based discrimination. That includes working to make sure that we address health-related disparities, including those arising from tobacco use, and that we optimize health for all. The evidence shows that for decades, the tobacco industry has intentionally and successfully marketed mentholed cigarettes to African Americans, and particularly African American youth and women, as replacement smokers. This targeted marketing has worked all too well. In the mid-1960s, less than 20% of African Americans who smoked used menthol cigarettes. Today, as a result of the targeted marketing of the tobacco industry, the figure is well above 80%. The net result is that our community suffers from the consequences of tobacco-related diseases and at rates that are far above what should be acceptable. Menthol cigarettes both contribute to youth tobacco initiation and makes it harder for smokers to quit successfully. Research shows that menthol smokers have a harder time quitting smoking than smokers of non-menthol cigarettes, and that tobacco use is a major contributor of heart disease, cancer, and stroke, 3 leading causes of death among African Americans. In 2016, this harsh reality led the National Association of NAACP to adopt a unanimous resolution supporting state and local policy efforts to restrict the sale of menthol cigarettes and other flavored tobaccos. The continued sale of menthol cigarette in the city has been harmful to all youth in the city, especially African American youth. Menthol in cigarettes makes it easier to start smoking by masking the harshness of tobacco smoke. As a result, more than half of all youth smokers ages 12 to 17 smoke menthol cigarettes, compared to less than 1/3 of smokers ages 35 and older. Among African Americans youth, the prevalence is even higher. 7 out of 10 African American youth smokers smoke menthol cigarettes. In order to end the disproportionate impact of these products on African American youth and to protect all children equally from flavored tobacco, we strongly urge you to adopt Intro 1345 to apply the same restrictions to menthol cigarettes that are applied to other flavored tobacco products. We also encourage this committee to amend 1362, a proposed ordinance that would prohibit the sale of flavored e-cigarettes throughout New York City, to include mint and menthol flavored vapor products on the list of prohibited items. These flavored products also appeal to children. Data from the 2018 National Youth Tobacco Survey showed that 52% of all youth who use e-cigarettes use mint or menthol e-cigarettes. Intro 1345 will protect the health of African Americans in New York City, reduce the number of youth who smoke, and reduce the deleterious impact of menthol smoking and tobacco use overall on Americans' health. By doing so, it will reduce tobacco-related health disparities, a critical public health goal. Intro 1362, if amended to include mint and menthol flavors, will similarly work to prevent our children from becoming addicted to flavored e-cigarettes. We urge the Council to approve both measures to fully protect all New York City children and the African American community from these deadly products. The leadership of the NAACP welcomes any questions you might have on the association's position and looks forward to working with you to pass and implement these policies.
Thank you very much, Madam Chair,
You're
for
welcome.
your testimony and your leadership. Please, sir.
Thank you, Chairman Levine. Councilmember Powers, appreciate the opportunity to be here today. My name is Bill Sherman. I'm the Managing Director of the American Cancer Society Cancer Action Network. We are the nonprofit, nonpartisan policy advocacy organization of the American Cancer Society. But I'm also here as a dad and as a son who has seen his father pass away from lung cancer at the age of 58. I have 3 daughters in school. I'm also a high school track coach. Every single day, I see the impact that electronic cigarettes are having on our youth. And in fact, my daughters are not able to go to the bathroom during the day because the administration locks the bathroom doors. Because the issue has become so prevalent in their school, unless there's a security officer there to monitor the use of the bathrooms. So, as you know, the stakes are high. Before I share some additional statistics, I also, Chairman, you had mentioned the leadership shown in this city by this council and by the administration over a number of years. I have a national view, working for a national organization, of the impact New York City has on health and protecting people's lives from across the country. I cannot emphasize enough the importance that this New York City Council and these 2 bills have on the impact nationwide. The stakes are indeed very high. And as a lifelong New Yorker, I'm proud of that. So we are pleased to speak in support of Intro 1345 and 1362. Every year in New York City, over 40,000 people are diagnosed with cancer. Even though the U.S. cancer death rates have decreased by 26% from between 1991 and 2015, as we've heard here today, not all Americans and certainly not all New Yorkers have benefited equally from the advances in prevention, early detection, and treatments that have helped achieve these historic rates. Significant differences persist in cancer incidence, survival, morbidity, and mortality among specific populations in the United States. Lung and bronchus cancer is the single largest cause of cancer death in New York City. We continue to see disparities by gender, race, ethnicity, and socioeconomic status. We feel this is unjust. Each year, more than 12,000 people in New York City die from illnesses related to tobacco use. The impact of tobacco use is far from just that health impact, which is significant. The annual health care costs in New York State alone, directly caused by smoking, are in excess of $10.4 billion in New York State alone. Last year, this council and the administration supported significant measures to reduce smoking, and we're proud to have been part of that. All of us are. We've also heard that in 2009, significant progress was made early on in the fight against tobacco. However, the federal and the city laws exempted menthol, mint, wintergreen flavors, and all flavored electronic cigarettes. So why does this matter? We've heard already that the high school incidence rate and use of e-cigarettes is at an all-time high and increased by 78%. Regarding flavors, the CDC reports that a full 68% of high school students who are using e-cigarettes use flavored e-cigarette products. To give you a tangible number, the 48% increase and the 78% increase in youth usage in middle school and high school, that equates to over 3.5 million kids used e-cigarettes in 2018. In addition, flavors are frequently listed as one of the top 3 reasons why children begin using electronic cigarettes. I want to address the FDA issue with regard to cessation. The electronic cigarettes have been out for quite some time. There's been a lot of talk about the potential for them for cessation. There's a reason that not one e-cigarette manufacturer that we are aware of or tobacco company has applied to the FDA for these products to be cessation devices, because they know that this will not pass the muster that's required. They do not have the data to back up their claims for cessation. If they did, they would have applied.
And just briefly, why is it that gum and patch have managed to meet those standards, but not e-cigarettes?
There was significant research done before that, and the producers of those devices and of those products had scientific evidence to support their cessation claims. There is, again, e-cigarettes have been around for a long time. We're now starting to see the huge impact and the growth among youth, but they've been around a long time. And certainly, if a company had data that supported their cessation claims, for sure, because of the financial impact on that company, they would go to FDA and start that process. And they have not. They've not even applied, to our knowledge. So we strongly recommend implementing evidence-based policies to prevent the initiation and use of all tobacco products. And we also agree that these electronic cigarettes, particularly flavored, are gateway products. Let me mention regarding menthol and mint. It's troubling because, as we heard just earlier, that the truth about menthol flavors is the chemical compound creates a cooling effect. It reduces the harshness of cigarette smoke and suppresses coughing. This makes it more appealing to young, inexperienced smokers. Research also shows that menthol flavor is likely to addict youth and makes it more difficult for adults to quit. We've already heard of that. There is no evidence that shows that menthol is safer than any other tobacco products. This myth has been perpetuated for decades by the tobacco industry. In fact, there's a research that has come to our attention that it's estimated if there was a nationwide ban on menthol, more than 320,000 deaths would be averted by 2050. Out of those 320,000, almost 1/3 of them would be African American lives saved. So we've heard about the disparities in menthol use among ethnicities. Let me also share some statistics regarding where they're used. In menthol, in the Bronx, people who use menthol or who smoke, 74% of people in the Bronx smoke menthol. In Manhattan, by comparison, 36% use menthol. Some 58% of New Yorkers at the lowest economic level, income level, smoke menthol cigarettes, while the New Yorkers at the highest level smoke menthol only at about 30%. The disparity is massive. And I'll also highlight that non-Hispanic black males have the highest cancer incident and mortality rate as compared to all other racial and ethnic groups. It is time to take a stand and pass both of these bills. We are in strongly support of that. Thank you.
Thank you very much, Mr. Sherman. We appreciate your powerful testimony, and I'm sorry for the loss that you referred to of your father. Thank you for turning that tragedy into positive activism. We appreciate that. We want to hear from everybody. I want to remind folks we have a long list of witnesses. If you can just bear that in mind in delivering your testimony. Thank you.
Sure. Thank you. My name is Michael Seelbach, and I'm the National Assistant Vice President for State Public Policy for the American Lung Association. On behalf of the Lung Association, we're pleased to speak today in support of Intros 1345 and 1362, assuming the edits get made that will ensure their comprehensive nature. You've heard a lot of statistics, and I'll try not to repeat any of the ones from my colleagues. You have my testimony for the record. But it's really important that if we're going to have continued progress on reducing both cigarette smoking and other tobacco product use, we need bold and swift action on the part of our federal, state, and local governments. But we cannot sit here and wait for potential action from our partners on the state and federal level. It's imperative that the city acts now. Waiting for other levels of government to act may lead to not only another generation of New Yorkers addicted to tobacco products, but ultimately will lead to more tobacco-caused death and disease. With regard to the bills being considered today, the Lung Association urged the Council to move forward and pass both proposed laws, which prohibit the sale of all flavored e-cigarettes and expand New York City's current flavored tobacco product restrictions to apply to mint, menthol, and wintergreen. Each day of delay benefits the purveyors of these products who continue to prey on our nation's children. As you heard, the 2018 National Youth Tobacco Survey, which was released in November, found that over 50% of high school students that use e-cigarettes are using mint and menthol flavors. We recognize that almost all tobacco users begin their use during their adolescence or young adulthood, and tobacco companies have spent billions of dollars marketing their products, making them more attractive to young people. It's well established that flavors are attractive to children and young people. The industry's decades-long conspiracy to deceive the public includes many documents that demonstrate the industry's understanding of the unique role that flavors play in tobacco use initiation. We saw with the recent advent of Juul that it quickly became the most commonly used e-cigarette product through the sale of their Cool Mint, mango, fruit, cream, and cucumber flavors. Other e-cigarette brands selling flavors like Gummy Bear, Atomic Fireball, Captain Crunch, and a wide variety of other fruit candy and sweet flavors are appealing to our youth. The American Lung Association strongly supports menthol cigarettes being removed from the marketplace and has been calling on such action since 2011. We testified back in April of 2013 in a formal citizen petition to the FDA, where we referenced FDA's own Tobacco Products Scientific Advisory Council, which concluded, menthol cigarettes have an adverse impact on public health in the United States. Menthol cigarettes offer no public health benefits. Menthol cigarettes increase the likelihood of addiction and the degree of addiction in youth smokers. Menthol cigarettes does not affect everyone equally. Use of menthol cigarettes is more common among youth, female smokers, LGBT smokers, those with mental illness, and racial and ethnic minorities, especially African Americans. And that's not by chance. The sale and marketing of menthol cigarettes disproportionately burdens the African American community as a result of decades of targeted marketing, as you've heard today. New York City, as we know, has led the way when it comes to fighting the scourge of tobacco use. It's imperative that the city steps up once again to fight the use of flavored tobacco and e-cigarette use in our city. The American Lung Association strongly supports these efforts and urges the council to quickly act to pass these bills.
Thank you, Michael. Robin?
Good afternoon, Chair, and thank you so much for the opportunity. My name is Robin Vitale. I serve as Vice President of Health Strategies for the American Heart Association here in New York City. And out of deference to the experts that have testified before me, I will be very brief. My testimony is in front of you. It, I think, reiterates many of the points that have already been mentioned. I do want to draw your attention to some specific research done by the American Heart Association's Tobacco Regulation and Addiction Center. Their studies have shown that 30% of teenage users said e-cigarettes taste better, have a bolder flavor, and have a less burnt taste than other tobacco products. And 42% said the ability to try many flavors sets e-cigarettes apart from other tobacco products. I think that speaks volumes to the motivation behind your bill, Chair, and I think with the addition of making sure that it is comprehensive in nature, making sure that all flavors, including mint, menthol, and wintergreen, are included, it will be a tremendous step forward in that particular cause. I'm not going to reiterate again the focus around menthol cigarettes, but I do share the perspective of all the colleagues that have spoken before me. As a national organization, this has been a top priority for the American Heart Association for numerous years. We were regretful that we were not able to include it in the initial bans, and certainly look forward to the city's efforts to address this very concerning addiction. And to that point, in your purview as chair of the Health Committee, one could argue there are very few other more impactful measures that you could prioritize than the ban of menthol tobacco in this city. We encourage you to take that responsibility very seriously, move very quickly on this proposal, and we look forward to working with you.
Thank you, Robin, for your activism and leadership in this and so many other areas. And I do want to clarify that we're working on some revisions to the language of Intro 1362 that would clarify that some of the flavors you mentioned, e-cigarette flavors like wintergreen, would also be covered by the ban. That's the intention.
Thank you.
Okay. Thank you to this outstanding panel. Thank you so much. We're going to go next to our next panel, which will be Deirdre Sully from Public Health Solutions, the Reverend Jesse Brown Jr. from the African American Tobacco Control Leadership Council, Kira Stevenson Valley from the National Action Network, and Commissioner Giles Chip from the National Organization of Black Law Enforcement Executives. Thank you and welcome. Would you like to lead us off? Can you make sure your microphone is on? There's a button right at the bottom.
Can you hear me now?
Yes.
It's on. Good afternoon, and thank you, Councilmember Levine and members of the Health Committee for the invitation to comment on these two bills. My name is Deirdre Sully, and I'm the Director of Public Health Solutions NYC Smoke-Free Program. For more than 20 years, NYC Smoke-Free has worked to protect the health of New Yorkers through tobacco control policy, advocacy, and education. We partner with community members, legislators, and health advocates to support local efforts to end the devastating tobacco epidemic throughout New York City. I am here today in support of these two bills that have been introduced and will address the public health concern for marginalized communities and subgroups. It's no secret that in the 15 years since the implementation of the Smoke-Free Air Act, New York City has seen great success in tobacco control and cessation. However, some populations and communities have not reaped the benefits of these policies put in place to optimize public health. The use of menthol cigarettes has remained significantly disproportionate among smokers. The cooling effect of menthol flavoring masks the harsh taste and strength of tobacco, triggering deeper and longer inhalation and increased addiction. Menthol is the flavor that initiates and then creates lifelong customers. Youth smokers are the age group most likely to use menthol. It is especially appealing for them as it is especially appealing for young smokers, making initiation easier and cementing addiction quicker. African American smokers in particular have been left far behind the curve, as the national average of menthol use rate among that population is a staggering 85%. The number is similar here in New York City. This pervasive marketing of menthol to marginalized communities is well documented. For decades, the tobacco industry has employed predatory and aggressive marketing campaigns to target marginalized populations, ensuring a constant supply of customers. There is no regard for health, only profit. Intro 1345 will address significant tobacco use disparities that exist among smokers in New York City. Other jurisdictions have done this, so we are not alone in these efforts. The inclusion of menthol as a prohibited flavor closes a decade-old gap that has for far too long created space for increased health equities. We're here also today to talk about flavors. Flavor additives have always been an important tactic for the tobacco industry. It is only natural to provide flavor options to their newest products, electronic nicotine delivery systems, your e-cigs and your vaping products. This is not by accident. E-cigarettes and other vaping products are branded and marketed to appeal to a younger target market using the same practices from the days of Joe Camel and the Marlboro Man. E-cigarette and tobacco company tactics include savvy media placements with celebrity endorsements, and from what we know now, fun product designs that resemble toys, i.e. the Juul, and enticing flavors that include menthol, mint, wintergreen, candy apple, cherry, and many others. Additionally, the use of e-cigarettes and other similar vaporizing products is strongly linked to the use of other tobacco products, including cigarettes, cigars, hookah, and smokeless tobacco, especially among youth. We have achieved great success in the years since the Smoke Free Air Act. However, we must be vigilant about keeping up with the tobacco industry's ever-morphing predatory practices to maintain their profit. As a public health advocate in the tobacco control industry, I know how difficult it is when your opposition seems to have bottomless pockets. It's a constant battle to stay up to date with the new ways Big Tobacco tries to hook customers. This includes their move to e-cigarettes, dispensing millions of dollars to specifically market and appeal to youth, using flavors as a tactic. We must continue to thwart their efforts and prohibit any attempt to repeat history or normalize any form of addiction. Thank you.
Thank you, and I just want to pause and acknowledge we've been joined by fellow member of the Health Committee, Councilmember Inez Barron from Brooklyn. Thank you. Please, sir.
I hear the hum, so I'm going to change my microphone.
Yes, thank you.
I'm Reverend Jesse Brown. I'm part of the African American Tobacco Control Leadership Council. We work nationwide to ban menthol in all jurisdictions everywhere, and we provide assistance to communities in various ways to see that that happens. The African American Tobacco Control Council strongly encourages New York City Council to restrict the sale of menthol in all flavored products, including flavored e-juices citywide in New York City. We already know that 80% of youth, 12 to 17, start smoking using flavored cigarettes. If the City Council truly wants a healthier New York City, and we believe you do, then it is imperative that the sale of menthol in all flavored tobacco products be restricted and predatory marketing of these products be realized as a social injustice issue, an issue that disproportionately impacts young people, poor communities, marginalized groups, and communities of color. Menthol and flavored tobacco products are driving tobacco-caused deaths and disease nationwide. While the use of non-flavored tobacco cigarettes has been decreasing, the use of menthol cigarettes is on the rise among young people, among the youth and adults, among Latinos, blacks, and whites. Let's be clear. The majority of women smokers smoke menthol cigarettes. Folks from the LGBT community disproportionately smoke these products. 40% of Latino smokers prefer menthol cigarettes. 62% of Puerto Rican smokers using menthol. Nearly 80% of Native Hawaiians, a majority of Filipinos, and a majority of smokers with behavioral health issues smoke menthol cigarettes. Frankly, most marginalized groups disproportionately use minty products. Moreover, 85% of African American adult smokers and 94% of black youth who smoke use menthol products. These striking statistics arise from the predatory marketing of these products in the black community, where there are more advertising, more lucrative promotions, and cheaper prices for menthol cigarettes compared to other communities. The City Council should be aware that menthol, as if to add insult to injury, masks the harsh taste of tobacco and allows for deeper inhalation of toxins and greater amounts of nicotine. Moreover, the presence of menthol makes cigarettes harder to quit compared to other cigarettes. The cool, refreshing taste of menthol heralded by the tobacco industry is just a guise. Ultimately, menthol allows the poisons in cigarettes and cigarillos to go down into the body more easily. We have been reading in the papers about the Juul explosion, where a little thumb drive looking device is used more than regular cigarettes among youth. And one of the major drivers of this massive undertake of e-cigarette among youth is the fact that there are over 15,000 kids using or part of the marketplace. The vapist community would like you to believe that aerosol inhaled by e-cigarette users is only water vapor. Nothing could be further from the truth. Here are some facts. E-cigarettes are tobacco products that deliver nicotine, an addictive substance that, especially in youth, can compromise the brain's executive functioning. There is as many, if not more, metals in vape or e-cigarettes. There are a number of other facts that I could present, but many of those have already been presented here today, and I don't want to prolong this hearing any longer than it has to go. So let me say this, that the African American Tobacco Control Leadership Council is calling on New York City Council to join a growing number of cities and counties around the country that are restricting jurisdiction-wide the sale of menthol cigarettes of all other flavored cigarettes, including these e-juices. In June 2018, San Francisco voters passed the first ever citywide restriction on the sales of all flavored tobacco products, including menthol cigarettes and flavored e-juices. This strong flavor ban law was rapidly replicated in the city of Richmond, California. Within weeks, Beverly Hills followed with their own citywide restrictions. Since November, the county of Moreno and the cities of Alameda, Santa Cruz, San Pablo, and others in California, other cities in California and in Massachusetts, all passed citywide menthol restrictions. Indeed, the Food and Drug Administration announced that it was contemplating initiating a process to remove menthol from combustible cigarettes and flavors out of little cigars. However, Governor Cuomo, after not identifying menthol to be regulated, has mentioned the need to regulate certain flavors in tobacco products. And I quote, "The budget will include a proposal to provide the Department of Health the authority to ban the sale of certain flavored liquids that target youth use of e-cigarettes." Frankly, it would be a game changer, not only for the health of New York City residents, but it would be a clarion call nationwide to get menthol and flavors out of tobacco products. These laws that are passed should also include money for cessation services to accompany the policies being implemented.
And Reverend Brown, I don't want to cut you off, but only because we have so many people waiting to testify. If you could try and wrap up.
I'm doing just that.
Oh, thank you.
We here at the African American Tobacco Leadership recognize that City Council is under extraordinary pressure from the tobacco industry and the vapist community to put profits above human life by not including menthol in its city's existing flavor restrictions. So please join the cities that have already done this around the country and stand up to the tobacco industry and their allies. And we call on no selling of menthol cigarettes and all other flavored tobacco products, including flavored e-juices, citywide in New York City. I hope this is the time we say no.
Thank you, sir.
Thank you.
Ms. Stevenson?
Hi, good afternoon. My name is Kyra Stevenson Valley, and I work at National Action Network. I'm the cessation coordinator. National Action Network is a national civil rights organization founded in 1991 by the Reverend Al Sharpton. Since our founding, NAN has continued to carry the mantle of Dr. Martin Luther King Jr. and his commitment to nonviolent social change. We are an organization that used nonviolent direct action to fight for the oppressed and forgotten. Our commitment to one standard of justice and decency for all is why today I am urging the New York City Council to consider the unintended consequences of a ban on menthol cigarettes as proposed in Intro 1345. Over 80% of African Americans who choose to smoke prefer menthol cigarettes. Thus, any consideration of a possible ban on menthol cigarettes will principally affect African American smokers. We stand with groups like the Drug Policy Alliance, the Law Enforcement Action Partnership, and the National Organization of Black Law Enforcement Executives, as well as NAN members from our chapters across New York City who are in the room today, in demanding that any conversation about prohibiting menthol cigarettes includes a candid discussion about racial disparities and selective prosecution in communities of color. First, allow me to start by saying that National Action Network does not want people to smoke. We don't want youth to smoke, and we want to try to help people who want to quit smoking quit. We know that Black smokers are more likely to die prematurely from tobacco-related diseases and are statistically less successful in attempts to quit than smokers of other racial backgrounds for a plethora of reasons. At NAN, I lead our National Cessation Program, and we are actually the only civil rights organization operating nationally that has a National Cessation Department, through which we are training our chapters across the nation to educate our youth about the dangers of smoking and the importance of deciding to be tobacco-free. We're offering resources and support for smokers who want to quit smoking. But conversations around the menthol ban often suggest that the legislation will help adult Black smokers stop smoking. We appreciate those within the public health community seeking to protect the health and well-being of the Black community. However, even policy with the best intentions can be vulnerable to unintended consequences. Here in New York, we find ourselves in a precarious position. On one hand, we are supporting the legalization of marijuana to overturn a prohibition that has had a disparate impact on African Americans. Just a few months ago, my colleague testified in front of the New York State Assembly to ensure that any legislation to legalize marijuana will include provisions for people who were disproportionately arrested due to targeted policing. Almost concurrently, I sit here before you today because New York City is considering implementing a ban on menthol cigarettes without careful consideration of the potential effects on the very same population. How do we reconcile these two opposing realities? How do we achieve progress if we ignore the lessons we've learned from bad policy? Recent history has shown us the disparate impact of bans and prohibitions on the African American community. It is proven that increased regulation does not necessarily stop users from consuming addictive products, but rather criminalizes addicts without resource. History has shown us that bans and prohibitions can often lead to an increase in negative interactions between law enforcement and African Americans. History has shown us that here in New York City, law enforcement can take your life over something as trivial as a loose cigarette. Before taking any further action on menthol, I urge the Health Committee to do more to investigate the consequences of the proposed ban, especially on the communities it aims to protect. I urge you today to proactively review existing research, seek advice from experts, and if necessary, commission the studies required to make a fully informed determination on the best course of action to reduce smoking in New York City. I invite you to work with us to increase culturally relevant quit smoking programs that are accessible for those who need them most. With careful consideration to the consequences of the proposed ban on menthol cigarettes, I hope that we can avoid repetitions of policies like stop and frisk that were specifically intended to protect Black New Yorkers, but instead only further ingrained systemic racism. Thank you for your time.
Thank you, Ms. Stevenson-Valley. Commissioner Shipp.
Yes. Chairman Levine and committee members, thank you for allowing us to give testimony today. I also would respectfully request to submit further information for your review at a later date. I know how difficult it can be to hear a lot of testimony throughout the day. I've testified in congressional hearings, state hearings, and other municipal hearings. And so I'm going to keep mine brief, and I'm also not going to read to you from the testimony. I'm going to talk to you from my practical experience of over 30 years in the law enforcement field at a state and local level. First and foremost, I'm here today on behalf of our current national president, Chief Vera Bumpers from Houston, Texas. I'm here representing NOBLE, which is an acronym for the National Organization of Black Law Enforcement Executives. And I'm proud to say, when we were formed in 1976, one of our founding members was the first African-American chief in New York City, Chief Bill Bracey. We are an organization of federal, state, and local law enforcement officials, including members of ATF. We have 56 chapters throughout the United States, the Caribbean, and the UK. As much as we agree with the intent, the proposed intent of the bill, we're very concerned about that being misguided and that the outcomes will be counterproductive. And I'm glad the chart was left up here. We feel that the way to really approach this problem and be effective is through education, not enforcement. If you look here at the chart that the Health Commissioner left up here, I will submit to you that that decrease was not because of enforcement. That decrease was, I would guess, was because of education. And you educate people on these issues, that is the way to reduce the usage and the consumption of these type of substances. And, you know, not only will the outcome be counterproductive, a firm example, we work now with NYU Law, the Brennan Center for Justice, and we're currently now, Law Enforcement Leaders is the name of the group that we are involved with there. And right now we're working, trying to reverse what happened because of all the laws that were put in place around marijuana. It had a devastating impact on communities of color. So many families were torn apart. We're still trying to reverse the incarceration rates of the so-called war on drugs, and when we're working with that issue very feverishly. What this would do as proposed, it would create an underground economy, all right? And that underground economy would manifest itself in the way of criminality. We don't need to be incarcerating more people. We need to be educating more people. And I know a little bit about building cases. I've worked for a municipal police agency, New Jersey Attorney General's office. In the way that we build cases, we will take the smaller act and we build it's like building blocks. We find a person maybe with a marijuana cigarette. Then we go to the person who's selling maybe a kilo. Then we build it up and we go to the kingpins. So that will, the way this bill is written, it would create an opportunity for law enforcement to use this as a pretext to engage someone that in other ways should have been engaged. And we know those outcomes are not always beneficial. We are working day and night to help try to bridge the gap between the community and police, and we think this effort will be counterproductive to our efforts in that vein. I also wanted to address the fact that, you know, I heard testimony earlier about the healthcare and the impact on African Americans, and true, there's a lot of reasons, as National Action Network has stated, the reason why African American males' lifespan is not as long as others. So it's not just because of cigarettes. I mean, there are a lot of other factors that I don't need to bore you with. But in conclusion, you know, again, I would urge you to research the matter a little further because we do not need unnecessary contact with people in the community who are not committing crimes. I'd rather turn those resources towards taking guns off the street and more important matters versus, I know myself, for me to hire 2 police officers, it's $250,000. And I don't know how big the city's budget is, but $250,000 for 2 people. And then I don't know if somebody's even talked to Commissioner O'Neill to see what the additional cost would be for the enforcement effort. And that's just on a municipal level. And that's not even counting the additional costs on a state level. But more importantly, it would be, as I said earlier, it would be counterproductive to the efforts that we are trying to make now to rebuild strong relationships between community members and the police. And thank you for this time. And I'm also available for any questions.
Thank you, Commissioner. And my colleague, Councilmember Powers, does indeed have a question.
Thank you, and I'm sorry because I have to leave in a second, so I want to just thank you all for your testimony. I would just wanted to raise that I think that the chart and the numbers that are going down are really about more than just the education. I just want to be on the right. I think that, and I just respectfully, that I think enforcement, I think limiting access, limiting glamorization and the idea that things are cool or whatever, in addition to the education around the harms, all those things work together. And I think education is very important to all the testimony we've heard today. Certainly, when the questions I asked earlier really reflect my desire to have more information about what are the harms, what is the pathway from an e-cigarette to a harmful, maybe potentially a more harmful product. And I think we actually have to have a conversation about that and educate folks about what is harmful, what's not. I would say respectfully that I think education itself here will fail if we just leave it to education versus addressing ways to limit access and ages and things like that. I will take the comment very seriously, and I would say to the chair as well, which is communities that have been harmed and have a long history here that you've had highlighted. I think we should certainly in both bills be sensitive to how we enforce and who gets enforcement, and how we make sure that anything we pass does not have a negative consequence. So I will take that comment back. I just want to be on the record saying I think education on its own could be a recipe for us being back here in some period of time and realizing that some numbers are going back up that have come down in the past. And I certainly can respond.
I respectfully appreciate your comments, and I also know, based on my experience, if people want to get something, they're going to find a way to get it. Okay, and usually it's going to be in an illicit way. We can go back to the prohibition of alcohol. So we really better pay a lot of attention to educating people on these issues versus so much effort on enforcement. And I understand the tax piece. We do that well. We collect taxes in this country probably better than any other. But one of the things that we don't need to do is ramp up enforcement, especially in a time like now when we're trying to strengthen police-community relationships.
I respect that. I will say that makes an argument against gun control as well, in my view. And I am in favor of gun control if you say that people will get it anyway. But I do think it raises the point of what will be access after we do something like this, and whether we are effectively limiting access or increasing enforcement and not limiting the access. So I'm happy to also to have a follow-up conversation with you as well.
I agree, and I think the enforcement side would be more beneficial on a federal level versus on a municipal level.
Okay, thanks. Thanks.
Thank you very much for another excellent panel. We appreciate you all speaking out. The following panel is very special. You will see why in a moment. We're going to start with Meredith Berkman from Parents Against Vaping. Grant Furman, also from Parents Against Vaping. Dorian Furman from the same group. Yael Mentz from the same group. Caleb Mentz. Rebecca Shalom. Mimi Bublik. Philip Furman. Dina Alessi. And Luke Alessi. We will get you extra chairs if we need it. Thank you for squeezing in. Okay, who would like to lead us off? And if you can make sure your microphone is on.
Is that working? Okay. Hi. My name is Dorian Furman. I am one of the 3 co-founders of Parents Against Vaping E-Cigarettes, or PAVE. We would like to thank the New York City Council Health Committee and Councilman Levine for proposing this very important proposal to ban flavored e-cigarettes. My 3 co-founders and I have 9 kids between the 3 of us in 6 different schools, aged 7 to 19 in New York. We came together last year when we realized that some of our kids and their friends were juuling, using e-cigarettes, and it was a growing trend in New York. In fact, we're in the middle of what the FDA Commissioner Scott Gottlieb and the Surgeon General of the United States have both labeled a growing epidemic of e-cigarette use among teenagers. I have all the figures, but you've heard them about 5 times already, so I won't go into every single figure, but suffice it to say that most kids today would have never picked up a cigarette with all the anti-smoking education that had been done. And then along came Juul. And with fruit flavors such as fruit medley, with flavors like mint, creme brulee, kids were using them with no understanding of the chemicals they were ingesting. Many of them thought it was harmless flavored water vapor. We've come to learn from studies done by Stanford University School of Medicine that the flavors in e-cigarettes prevent children from perceiving danger and for understanding that these products are addictive. It's the flavors that hook the kids. In fact, according to the Truth Initiative, 63% of kids surveyed did not know there was always nicotine in their e-cigarettes. And yet, there is still no proof that the flavors will help adults stop smoking regular combustible cigarettes. New York City is in the midst of this epidemic. As you will hear from some of the teenagers and young people testifying today, juuling or vaping is rampant in New York City schools. Kids as young as 6th grade are being caught vaping. Other kids are worried to go into the bathrooms because they don't want to be caught with other kids who are vaping. A member of our PAVE advisory board, Dr. Jonathan Avery, is the director of addiction psychiatry at Weill Cornell Medical College and the New York Presbyterian Hospital, and he just created a nicotine addiction program for the almost daily requests they receive from families whose kids are addicted to the nicotine in e-cigarettes. It's ironic that you have to be 18 to buy nicotine gum or patches, and that is very strictly enforced, and yet everyone can seem to get flavored e-cigarettes. New York is a leader. What New York City does, the state follows. What the state does, the country will take notice. Please take a stand today. Prevention is key. Please pass this bill and protect New York City kids from these addictive flavored e-cigarettes. And now you'll hear from the kids.
Thank you.
My name is Caleb Mintz, and I'm here today with my mom and our grassroots group called Parents Against Vaping and E-Cigarettes. In the beginning of the first time I saw a Juul, I experimented with it as many of my peers did. And I'd just like to let you guys know that Juul has become so prevalent that I know all too well the smell of mint Juul pods and mango Juul pods in a way. Juul slang has become a universal language amongst teens. Previously, when visiting a new town, making conversation amongst kids would consist of sports and TV, and now I can reassure myself knowing that if I say, "Do you have a Juul?" or "Do you have a pod?" I've immediately connected with another kid. I believe the extent of juuling is far worse than many believe. Previously, in regards to cigarettes, there was a stigma associated with kids who smoke cigarettes. These kids would often be characterized as rebels, rule breakers. I think Juul has become so widespread that there is no specific group you can pinpoint who juuls. It is no longer a specific group who juuls. It is almost as if at least one teen from every social group juuls. There used to be With Juul, the device looks slick and modern, and due to the lack of combustibility, the stigma has been removed. I recognize that my generation isn't the priority. Preventing younger kids from juuling is, to me, the priority, and I can't help but feel as if my generation is going to be defined as the generation of damage control. Thank you.
Thank you, Caleb, and your generation certainly is my priority. It's why we're here today, and I thank you for speaking out and being so eloquent. what would you estimate as the number or the percentage of your peers at your school who use e-cigarettes?
So I'd say it's hard to get a percentage, but I'd say everywhere I look, there's, at least one person from every group, who has a Juul or has Juuled, so it's fairly frequent.
Could you say anything about the role of flavors in how frequently kids are using flavored e-cigarettes?
I would definitely say that without flavors such as Cool Mint or creme brulee, a lot of kids would not be enticed by flavors like tobacco or methanol. I think the flavors definitely played a part in drawing teenage customers.
Okay. Can you say anything about where it is that kids are getting e-cigarettes in a city in which you have to be 21 to buy in a store? Is it that stores aren't asking for identification? Or if you don't feel comfortable answering, you don't have to, sorry.
I would say a lot of people have older siblings who are, of age, buy the Juul pods for them. Buying online is actually fairly frequent amongst my peers. I think, you can go on eBay and they don't require age verification, so it's pretty simple to do on eBay. I would also say that not all stores, but there are a small number of stores who will cater to teenage customers, but I think if I wanted to Juul, by the end of tonight, I could probably have pods in my hand in an hour, so.
Wow. Well, that's very frightening, but to have your voice sharing with us the difficult reality is incredibly important. Thank you, Caleb.
Thanks.
Thank you. Please.
Hello, my name is Yael and I'm 11 years old. My mom is the co-founder of PAVE, but I want to make it clear that these are my words. My parents didn't want me to speak today because I'm younger, but I felt strongly I needed my voice to be heard. I'm here today because I want to help keep Juul and other flavored e-cigarettes away from me, my friends, and other kids our age. I know kids only a year older than me already sucked into the world of Juul. I'm in 6th grade and am beginning to notice people my age looking up to those who Juul in the grade above us. I even see them hanging out with Juulers in the bathroom where middle schoolers are vaping. Not only are youth and teens being fooled, but parents are too. I was once visiting a friend of my brother's when I spotted a Juul charger that his mom was convinced was a flash drive. I know how Juul messes with your head. On my way home from school every day, I pass by bodegas that have a big sign outside the door reading Juul sold here. Included is a picture of a sleek, elegant-looking device, the colors ranging from black to rose gold. If I didn't know any better, I'd want to have a rose gold one in my bag too. The cool design and pretty colors draw in youth. It's so easy to be fooled by Juul's tricks, such as the flavors that captivate your attention. The flavor names make it sound like a candy that you can enjoy as a treat to relax after a long day of school, and there isn't any knowledge great enough to stop someone from doing something that has a cool connotation. If these flavors are banned, not only will fewer youth and teens be drawn to vaping, but they will also know that it is a problem for kids and teens to use these devices. If you look at the name of Juul flavors now versus before they were called out for targeting youth, you will only see a difference of a few words. Cool cucumber is now cucumber. Creme brulee is now creme. Other vaping companies such as Blue have flavors like blueberry, mint chocolate, and cherry crush. Who are these companies kidding? I'm a kid and I say enough is enough. Stay away from my older brother and his friends and don't go anywhere near me or mine.
My goodness, that was very powerful testimony, Yael. In my time in the council, you're the youngest person to testify and also one of the most eloquent. Thank you for speaking out. I know that wasn't easy, but your voice also is incredibly important. And I don't want to, I'll turn to your mom for input. I don't want to put you on the spot, but I just want to clarify, you're a middle school student, correct? Can you say anything about how many or what portion of the kids in your middle school are using vaping?
Well, I don't know an exact number or percentage, but I do know that there are many kids who are doing these things at bat mitzvahs, in the bathroom, places like that, and it's very secretive, but it happens a lot in middle school.
Okay, well, that is particularly alarming to think about kids in 7th grade already getting addicted to something that they could be struggling with for the rest of their life. That's why we're here today, to stop that. We're here for kids like you and your brother and the rest of the young people who are speaking today. Thank you for speaking out.
Thank you.
Thank you.
Hello, my name is Grant Furman. I am 14 years old and in the 8th grade in New York City. 2 years ago, when my brother was 14 and at the end of 8th grade, he started juuling. At the time, I didn't know what it was, but I would see him sucking on a flash drive device and smell something sweet. Now I definitely know what it is. Everyone is juuling. Some people I know started in 7th grade, and my school even found out about a 6th grader doing it. Last year, when I would go into the bathroom, it would smell always of Juul. I tried it once, but I didn't like it. Also, I saw my brother using it and saw how difficult it was for him to stop. My mother explained to me how dangerous and addictive it was, so I never touched it. Many kids think it's just water vapor and flavorings. They do not know how much nicotine is in a Juul. I know that e-cigarettes are very addictive, and there are a lot of chemicals in addition to the nicotine in them. People think that they're safer than regular cigarettes, but that does not mean they're safe. No one really knows what is going to happen to you in a few years if you start using it now. Most kids start with flavors. It is easy to get these flavored pods in smoke shops and convenience stores in New York. There are many of them within a few blocks of my school or my apartment who advertise flavored e-cigarettes and pods. I know some of them even sell to kids. I believe that the city should do something to stop these kids from using e-cigarettes and becoming addictive. You should definitely ban flavors so that more of my peers do not start, and also take someone's license away if they're caught selling to kids. My younger sister is 7, and I want to protect her. I do not want her to grow up in a city where kids start vaping in the 6th grade because they think it's safer.
Thank you, Graham, as well, for speaking out. If you're comfortable, you talked about young people not entirely being aware of some of the chemicals in these products. I would assume that they experience the addiction, which is this feeling that your body just wants more of this, even if your mind doesn't. Do you have friends who have fallen into that pattern of just needing to vape, even if their head tells them it's not a good thing to do?
Oh yes, I definitely know people who experience it and know that it's bad but cannot stop it. It's kind of like when you're a kid and you want sugar a lot. Even though you know it's bad for you, you just always want it. And that's kind of the same, and that's what's happening now in middle schools and high schools.
That is the nature of an addictive substance, and that is what is most frightening about young people juuling, because even when they want to stop, they can't. And the solution is for young people not to start.
Yes.
And we believe that flavors are enticing people, young people, kids, to start. And that is what we're focusing on with this legislation. Thank you, Graham, for speaking out.
Thank you for giving me the time.
Hello, my name is Philip Furman. I am Grant's older brother. I live in New York City, and I'm here to talk about my experiences with juuling or vaping. The first time I juuled was at the end of 8th grade. My friend handed it to me, and I had no idea what it was. I took my first hit, and I coughed a little, but I liked it. The thing that I liked most was the minty feel in my throat. The thing that enticed me the most about Juul was the mint and the high-tech device. It was like gum, and who doesn't like gum? A few weeks after that, I bought my own for the summer, and I started using it. At first, I would get my pods online. Then, when I started 8th grade, I would just get them near my school. It was really easy. You just needed to know where to go and which convenience stores. When I got to school in the 9th grade, I was surprised to see how many other kids had also started or had been juuling, and how easily I could connect with them about it. It started to cause tension in my family when my mom found my first Juul. After she found it, I got a new one a few days later, and the cycle continued. It did not only cause tension in my family, but I also wasted a tremendous amount of money on pods that I started to buy more and more often. By the time I realized it was bad and that I should stop, it was too late. I was already addicted. That happened around the end of 9th grade. Every time I tried to stop, I couldn't because every single party or social gathering I went to, there would always be Juuls floating around and I just couldn't resist myself. I would end up taking a hit, liking it so much, and then getting one at the end of the night. Then I would keep it for a few weeks until I'd realize how bad it was again and throw it away, and the cycle would just continue and I would waste even more money. I see so many of my friends who have the same problem as I did, and they don't even know it yet. Luckily, I have been able to stop, even though it was difficult then, and still is now. If you ban flavors, kids will not have an opportunity to start, and they will not find themselves in the same situation that I was in. Thank you.
Thank you, Philip, for speaking out. And I am so happy that you have overcome this addiction. I'm guessing you have many friends who are still struggling with this.
Yes.
Is that right?
That's true, yeah.
And friends who have come to realize what's happening, that nicotine is addictive, but even when they try, are just not able to stop.
Some have come to that realization, but there are others who still haven't, who don't fully know all the bad things that are in the Juul or other vapes.
Okay, thank you, Philip.
Hi, my name is Luke Alessi. I'm 16 years old and a sophomore in high school. I'm here today to support the ban on flavors in e-cigarettes. As a teen, I cannot escape vaping. It is all around me. Yes, I tried vaping, but it wasn't for me. But there are so many of my friends and other teens that are addicted and they cannot stop. It is everywhere, in school bathrooms, walking down the street, at parties. It's even sold at convenience stores to teens and by other kids. And all you have to do is slip them another $5 and someone will sell it to you. It's really annoying to me that advertisements as social media makes it so cool. There's a slogan called "Do It for Juul." So even if Juul is no longer on social media, it doesn't matter. All the teams are on it for them. As a teen, we think we're invincible unless someone shows us the impacts of vaping. Most will not believe it's bad. If you were to ask a teen to smoke a regular cigarette, they would say no, because they were gross. It took us years to get there. Why is vaping cool? Is it just as harmful? Why are we making the same mistake twice? Vaping is a big tobacco 2.0, and we need to stop it now. Please support the ban on flavors and save my generation from becoming a generation of addicts.
Thank you very much, Luke. And you said something I just want to emphasize. You said that for young people, a traditional cigarette might disgust them because of the taste or the smell or the smoke, but that they're not feeling that resistance with vaping. Is that right?
Because they think it's like safer for them. They think it's fine. Like there's no chemical. They don't know what like the danger of it.
And I had asked Caleb this earlier, but can you comment on the role of flavors in?
I feel like the flavors are a big portion. Like kids wouldn't use like a tobacco flavor because they don't like the taste of it. The flavors entice kids to use it. As Grant said as well, with the sugar, kids want the taste that's like good for like, yes, I like this, like bubble gum. They want to chew it, or like mint, so they enjoy it.
Can you comment on the most popular flavors?
Mint, mango, and cucumber.
Okay. My goodness, this is a very powerful group of speakers. I don't know if the parents are, is there another, would you like to contribute? Okay, please.
Hi there, good afternoon. My name is Mimi Boblik. I want to thank you for the opportunity to speak today and to let my voice be heard. My family lives here in New York. I'm a mother of 3 kids, 2 in college and 1 in 9th grade. For kids growing up in New York City, juuling and vaping in general has just become normalized. It's all around them. As you heard today, it's at school, at every party, on the street, it's everywhere. This is the generation that believes smoking combustible cigarettes is bad for them. We as parents spent years making sure of that. And now, in the blink of an eye, this same generation of young people is hooked on Juul and other e-cigarettes because the flavors have fooled them into thinking that they are only vaping flavored water. I joined PAVE because I'm horrified by this epidemic, and I'm currently working on outreach to educate teachers and kids on the real dangers of these products. I know for some of our youth it's too late for prevention, and I see that they will have to find addiction centers which are not being built fast enough to keep up with the rise in teen addiction. We need help to prevent more kids from starting, and the way to do that is through a flavor ban. Every kid I've asked about what enticed them to start vaping mentions the flavors, and the research validates this. You've heard all the research today. These flavored products are so clearly marketed to hook kids, and it's working. Every day I see the heartbreaking emails that come into PAVE from mothers begging for help for their teen who is addicted to nicotine and is desperate for a solution. I'm hoping that won't be me someday. But as they say, hope is not a strategy. We need real change. Take away the flavors and you take away much of the temptation. Our underage kids can easily buy these vaping products in many stores across the city, as you also heard today. So other changes need to be made to limit access to these products. But the flavor ban must be at the foundation of the change and will be a great start to ending this epidemic for the youth of our city and to set an example across the country. We are so grateful to those of you supporting this effort. Thank you again.
Thank you. Please.
Is this on? Hi, Rebecca Shalom. I live in Manhattan, and I have 4 kids between the ages of 12 and 18. And I come to the, I really want the flavor ban. I was in a bodega where I saw an 11-year-old buying flavor pods. And I spoke to the owner, and most bodegas are in under-market rent situations. I come from a real estate family. I know the situations they're in. They need to pay their rent early because they could be kicked out and evicted very easily. They're making a lot of their money on Juul products, and they're not checking ages of who the buyer is. And I don't see that as a situation that's really, you can't really regulate that. The bodegas sort of are on their own. And so I just wanted to bring the correlation between the whole New York City real estate landscape and the sale of these products. That's one thing. Another thing is a lot of students who are on scholarship are getting expelled from schools as a disciplinary consequence for having Juuls at school. Schools don't know what to do. This all came really quickly. So there are all these wonderful programs like Prep for Prep and Prep 9 and Oliver Scholars who work with students, deserving students, and place them in the most incredible educational institutions. And I have a son who goes to a boarding school outside of Manhattan. His roommate, who was on, with Oliver Scholars, got expelled from having a Juul with him. He wasn't even using it. So I just wanted to let you know of that consequence as well. It's a real disruption for their education.
Thank you, Rebecca.
Okay, you're welcome.
And thank you to the parent leaders for putting this coalition together, and to the young people. Is there one more to speak?
I'll
Forgive
be very
me.
brief. I apologize.
Yes.
I think, well, first of all, I think everyone in this room would agree that we all want harm reduction for adult smokers. So this is not to say that our desire to support a flavor ban or our desire to speak out today is because we don't want harm reduction for adult smokers. So I just want to, I'm sure we are all in agreement, but we're here because we're parents against vaping e-cigarettes. That doesn't mean we want to ban e-cigarettes. It doesn't mean we would want to ban the Juul. We're just focused on trying to stem the tide of what the Surgeon General and the FDA Commissioner have repeatedly called a youth epidemic. And more importantly, we want to make sure that not only is the tide turned, but that younger kids, middle schoolers, are prevented from starting. And so while the 78% increase in use of Juul and other products of flavored e-cigs by high school students is staggering, it's that 48% increase between 2017 and 2018 among middle school students. That's even more staggering. And we are so grateful for your leadership in proposing this flavor ban bill, because we know that the evidence is telling us the truth. Flavors hook kids. If you look at research done out of Stanford University Medical School, published in JAMA in November, a group led by Dr. Bonnie Halpern-Felsher, the head of adolescent medicine research at Stanford, you will see flavors hook kids. That study was also the first that looked at Juul hooking kids through flavors. So we have evidence that, can I have some water? We have evidence that flavors hook kids. There's no evidence that proves that removing flavors from the market, thank you, would harm any adult smoker who might use one of these products to switch and quit. there's no evidence, there's no conclusive evidence that these products will help adult smokers stop smoking. God willing, they would, but there's no conclusive evidence of that. And there's certainly no evidence that removing flavors will harm any adult smoker. But we do have the evidence that the flavors hook kids, and we've heard all the numbers and all the harm today. So we do believe that a bill like this passed in a city like ours sends a very, very strong message to other states, to the FDA, which has taken some action, but not enough, and to companies like Juul, one of the kids said, Big Tobacco 2.0, getting a $13 billion investment from Altria, a company that is a tobacco company. The secret's out. It is Big Tobacco 2.0, and we have all seen this happen before, and not on our watch will we let our kids and everyone else's kids get addicted to nicotine through these flavored products. So thank you so much for proposing this bill, and we hope the bill will pass. The FDA will take action because New York will be a leader, because our kids they do not deserve to feel like they're the generation of damage control, or for the younger kids to feel that they're in danger of being sucked in to this. So thank you.
Thank you very much, and thank you to the parent leaders, but especially thank you to the young people for having the courage to speak out. There's no way that I, at that age 12 or 15 even, would have had the courage to do what you just did. Actually, did you say you were 11, Yael? Oh my goodness. So you're years ahead of me and probably most elected officials. When you're 18 and want to run for office, please let us know. But on a more serious note, I think these were the most important voices of this entire hearing. We needed to hear from you. We needed to hear from young people who are confronting this every single day, yourselves and your peers in your schools, out in the neighborhoods. Thank you so much. The hearing would have been incomplete without you. You added a very valuable perspective. Thank you.
And they get public service credit for being part of the governmental process, just so you know.
Even better. Thank you.
Thank you.
All right, our next panel is going to be John Connolly from Blue Water Investigations, Ken Sharath from Rutgers, David Abrams from the NYU College of Global Health, Damon Jacobs, we have two forms from Damon Jacobs. I assume it's the same individual. Cynthia Cabrera and Richard Marianos. Okay, and I believe that due to time constraints, Kevin Sharath needs to go first. Professor, do you want to lead us off?
Sure. My name is Kevin Shroth, Chairman Levine, members of the committee. I'm a professor at Rutgers University School of Public Health. The last time I testified before this committee, I was working as an attorney for the Department of Health. In that role, I helped craft the city's tobacco control policies, and I appreciate the opportunity to be here right now. First, I'd like to commend the Council for its leadership in responding to the devastating health crisis posed by tobacco use and for taking on flavors in tobacco products and electronic cigarettes. Despite New York City's leadership and progress on this issue, tobacco use is a leading cause of premature preventable death, and more work needs to be done. Menthol and other flavors play a leading role in the increasing youth use of tobacco and e-cigarettes. First, related to menthol, months after the U.S. banned the sale of flavored cigarettes in 2009, New York City was the first municipality in the U.S. to ban flavored tobacco products other than cigarettes. However, both federal law and New York City's law created an exemption for menthol. In 2009, the menthol exemption was understandable. Now, mounting evidence shows the detrimental effects of menthol cigarettes on population health. San Francisco, Canada, the European Union are leading the way on this, and the FDA made a historic announcement announcing its plan to ban menthol cigarettes. But even in a best-case scenario, the FDA rule is unlikely to go into effect for several years, and this is incredibly important for New York City to do this. I think that this menthol ban above any is probably more impactful than any other single measure that New York City could take right now. And I concur wholeheartedly with all of the testimony so far in support of the menthol ban.
And I neglected to mention that we did start the clock because we still have a very long list, but you can take some additional time.
Okay, I will go through my testimony quickly. I do have a couple points, including some that have not been touched on by other people. And I will skip right to those. One is that with respect to flavors and tobacco, nobody has talked about flavored cigars. New York City already has a law that bans the sale of flavored cigars. However, in recent years, tobacco manufacturers have been devising ambiguous names for cheap flavored cigars and cigarillos that do not indicate if a cigar is flavored. For example, by changing the name of a cigar from grape to Purple Reserve, those cigars no longer fall within New York City's enforcement protocol. Other names include Tropical, Pink, and Summer Love. Over the past several years, cigars with these ambiguous names have increased in their market share from 9% to 15% nationwide, and that figure is probably significantly higher in jurisdictions that have flavored bans. New York City can close this loophole by requiring manufacturers to certify that their cigars are not flavored as a precondition for selling them in New York, and prohibiting wholesalers from supplying retailers with cigars that have a certificate that are not flavored. Regarding flavored electronic cigarettes, on a population level, there's increasing concern that a lasting legacy of e-cigarettes may be a generation of youth addicted to nicotine by flavored Juul and similar products. That said, there is anecdotal evidence that adults who use e-cigarettes exclusively and regularly may have some success in quitting smoking. For this reason, while I applaud Intro 1362's goal, I believe that it can be equally effective if it is less extensive, and therefore I recommend an e-cigarette flavored ban that does not extend to retail electronic cigarette stores, also known as vape shops, that sell e-cigarettes exclusively and do not permit people under the age of 21 from entering. Vape shops are already required to get an e-cigarette license, and they're subject to a retail density cap, which will prevent the market from expanding. Based on that evidence and the threat of losing their license, I trust that vape shops are responsible players in this market who are unlikely to sell to underage youth. In short, I support a ban that bans the sale of flavored e-cigarettes and refills except for vape shops. This would remove flavored e-cigarettes from convenience stores, and it would reduce the number of retailers selling flavored e-cigarettes from several thousand to several hundred. Thank you very much.
Thank you. I'll get to you in a second. I just want to point out that we heard from young people about how easy it is for an older sibling or someone else who's of age to purchase these materials and pass them on. So even a shop that prohibits young people from entering doesn't prevent these products from winding up in the hands of kids.
Well, all of the testimony from the youth who were here today, and I agree that it was extremely compelling, mentioned that it was relatively easy to get electronic cigarettes from convenience stores. And convenience stores, I think, are a bit of a different animal than vape shops that would only be selling a product that cannot be sold to somebody under the age of 21.
I'd like to test that proposition. I'm not convinced that a 19-year-old couldn't stroll into one of those and under certain circumstances would not be asked to produce ID. I hope there's an enforcement program on that, but I think you run into the same problems. I understand it's a more protected environment, but that would be a pretty big loophole to leave if we exempted those sellers, in my opinion. But I appreciate your input. Yes.
Good afternoon.
I think that mic is we should probably get it off the table if you could try the other one.
Ooh. Okay. Well, thank you. There we go. My name is Damon Jacobs. I want to thank you, Councilman Levine, and thank you for the committee for listening to all this. I know it's a long day. I want to correct one thing you said earlier at 1 o'clock, that Amazon does not sell e-cigarettes. And the reason I'm beginning with that is because it is one of many facts that have been stated, or things that have been stated in this room, which are not fully sustainable or supportable with facts. And I think when we're having this argument or debate, which is fairly emotional for many people, it's really important that we stay fact-based and data-focused. I'm a licensed marriage family therapist in New York State, and I love being a New Yorker for so many reasons that have been mentioned today. It was mentioned earlier that New York State has always been the leader, and you said, Councilperson Levine, that we like it when New York City is the lead. I love that too. We have been the leaders in the 60s in making methadone available and accessible, in the 90s in making needle exchange accessible. In just the last 5 years, New York City took a very firm affirmative stand, allowing PrEP to be available here, as well as signing the undetectable equals untransmittable statement. But I don't feel like that argument or debate is being said in a balanced way in this room by lack of the fact that you had 21 speakers who were all given approximately on average 10 minutes to agree with your position versus those of us that made dissent. I do honor and respect the energy and the voices here, and I'm going way off script because there's a lot more I could say. We do have facts, we do have data. Dr. Abrams is an expert in this, and given enough time, he could tell you a lot more about the compelling data that's available.
Instead of using your time to criticize the process, why don't you use your time to make your case?
All right. Public Health England has told us that by decoupling nicotine from smoking tobacco, vaping can reduce the risk of serious tobacco-related problems like lung cancer by about 95%. An analysis by New York University's College of Global Vaping estimated that 6.6 American lives could be saved if U.S. smokers switched to vaping in the next 10 years. As someone who has been working and serving the HIV-positive community in New York and California for well over 20 years, I can tell you, and the data sustains, that more than 40% of people living with HIV have been addicted to nicotine. And there's many reasons we could go into for that. But the point is, many have also found that switching to vaping has saved the quality and enhanced the quantity of their lives, and that vaping is a viable legal option for them to do so. I was also very compelled and very moved by the testimony of the panel that just came before us. I was very compelled by the young people. And I want Yael and everyone to be able to go to school without having to be confronted with harmful measures, without vaping, without alcohol, without marijuana, being able to go to school safely. But I do think that makes a stronger argument for prioritizing education over enforcement, putting the science over the stigma, putting the data over the dogma, and having a more nuanced conversation about this than just the emotional reactions that I'm hearing. And I would honor and love to have more of a conversation with you and with anyone on the committee about this.
Well, I appreciate you speaking out, Mr. Jacobs, and we're glad you're here and care about your opinion. As I mentioned in my opening statement and since, I do think that it's a good thing when someone gives up tobacco, and if e-cigarettes make that possible, that's a step in the right direction. I think we can continue to allow that kind of harm reduction strategy while doing more to protect kids.
I agree with you 100%.
As for your statement about Amazon, maybe we're using different apps, but right here I'm looking at 4-piece multiple choice pods for Juul. I'm on the Amazon app right now, so I'm not sure. Maybe this is only additional paraphernalia, but it's right here. You can come look at it.
I would love to look at that. Because my Amazon app does not sell Juul, does not sell vaping products. It might sell a container. And again, that is not good either.
4-piece multiple choice pods for Juul. Yes. But anyway, we're not here to regulate e-commerce. We're here to regulate what's sold in the stores of the city.
Yes.
And I do appreciate your input on that. And
I think we can protect youth and save adult lives at the same time. I don't think it's a dichotomy. I don't think we have to do one or the other.
Okay, well, that's our goal. Thank you.
Thank you.
Mr. Jacobs.
Thank you. I'm Dr. David Abrams, a professor at NYU College of Global Public Health. I speak for myself, and I have no financial disclosures. I urge you to oppose the ban on flavored e-cigarettes. Millions of smokers have already successfully quit by vaping, and many of them cite flavors as vital in switching completely from inhaling toxic tobacco smoke to much less harmful e-cigarettes. The data and the science are extremely strong. Scientists do change their minds when new evidence is available. I know this firsthand. I was wrong about opposing e-cigarettes early on. I shared the concerns of many here. But as I reviewed the mounting stronger scientific evidence, the evidence clearly shows that vaping, while not harmless, presents a fraction of the risk of smoking and can help people quit. The evidence is much stronger than you have been led to believe. I changed my mind. We don't know everything about vaping, but we do know more than enough to recommend smokers switch completely. Smokers don't even know that vaping is much less harmful and less likely to switch if they don't know it's less harmful. Why would you ever switch if you have doubts that vaping is less harmful than cigarettes? Fewer than 1 in 5 smokers understands vaping is substantially less harmful than smoking, and I fear flavor bans on vaping will worsen this confusion. Nearly 1 million New York City residents still smoke. 2 Americans will have died prematurely early from smoking in the time that I deliver this 2-minute testimony. I too want to protect youth. I have a 14-year-old granddaughter and 11-year-old grandson, and I take this very seriously. But New York City is already doing so, having banned flavored cigars and purchase of all tobacco to those under 21. Enforcement and education are critical. Parental smoking is also a major risk factor for youth smoking. This bill would make it harder, especially for lower socioeconomic smokers, to quit and have access to vape, and therefore they will unintentionally increase the risk of their youth starting to smoke. This may seem counterintuitive, but if policymakers only relied on intuition and gut feelings, you wouldn't need science or scientists like myself. Please don't put barriers between smokers, as hard as it is for them to quit, and the vaping products that could save their lives and save the lives of children too, who would otherwise be smoking.
Thank you, Dr. Abrams, for your testimony and for your work in this area. I haven't heard anyone today dispute the notion that e-cigarettes are less harmful than traditional cigarettes. I certainly haven't made that point. And what I've said many times is that I do want adult smokers to be able to give up tobacco and move to e-cigarettes as a harm reduction strategy. But they get all the health benefits if it's a tobacco-flavored e-cigarette. They don't need to have something that looks like a Fanta bottle that's attracting kids, right?
I disagree with some of what you've said. I agree that no nicotine product should be marketed in a predatory way to youth at all. However, some of the testimony from the youth, and a couple of them reminded me of my grandchildren, also showed that if they want to get this, they'll get it. I'm not sure a ban in either retail stores or vape shops will be as effective as you think it is. That's an empirical question, number one. Number two, I do think there is increasingly strong evidence in published peer-reviewed journals that not only does vaping significantly help smokers who've tried nicotine replacement therapy and other ways to quit and failed, and more importantly than that, there is increasing evidence from several recent studies, again in peer-reviewed journals, that flavors other than tobacco and menthol help them significantly to switch completely and prevent relapse or dual use to both smoking and vaping. And that's both common sense, what I call what your grandmother knew already, as well as solidly supported by psychology and learning theory. And that is, if you've been smoking for 40 years and have a classically conditioned memory of the taste and smell of a cigarette, primarily a regular cigarette or a menthol cigarette, then the only way you can switch completely is to forget about those tastes and not be reminded of the craving, and that would promote relapse. So it's very significant that the majority of over 100,000 successful switchers to vape have said that they used the very flavors that are not menthol and not tobacco. And I fear that a tobacco vape actually is so close to a cigarette that you're actually helping big tobacco continue to sell cigarettes, and you're promoting dual use. And you have major unintended consequences if you don't look at this in a more complex way.
Well, look, the ultimate break from the flavor of tobacco is to go flavorless, and that's an option for adult smokers and anyone else. And as for your assertion that a ban in New York City wouldn't prevent anyone from getting access, look, until we have national policymaking on this, that will always be true to some extent, but in many, many, many areas, we have regulated what can be sold and how it can be sold in New York City, from the availability of trans fats on restaurant menus to the highest price for traditional cigarettes in America. And yes, you can go elsewhere and get those things, but in every case where we've made that legislation, it has reduced the consumption in New York, particularly for people who have not yet started. There, the convenience and availability is a major factor. And sure, you can still go on eBay and order your Fruity Tooty flavors, but it's just one more obstacle in the way. Because the lives of the young people are on the lines, I'm all for adding as many obstacles to young people becoming addicted as we can. I'm sorry to move on because your perspective has been extremely valuable to hear. Very quickly, because we have a very long list of people who want to speak.
The one thing that makes this logic somewhat concerning is if you continue to allow the most lethal cigarettes to be sold in every mom-and-pop convenience store, and you have done that for decades, and you somehow trust that the store aides and the enforcement of age 21 laws will keep most of that away from youth, I don't see how you can, in a sense, turn things upside down and make a far less harmful product completely unavailable while leaving the most lethal product in every convenience store.
Well, I'm not sure whether you have, first of all, folks, you're new around here, and if you want to signify support for a speaker, you can go like this, but we don't allow those kind of disruptions. You're welcome to do that. And I know you all are new around here, not because you didn't know about the prohibition on clapping, but because you must not be aware that we have aggressively acted to reduce the availability of tobacco sales in New York City. We have capped the number of retail outlets. I discussed this with the commissioner earlier in the hearing. We are gradually reducing that to 50% of the current level. We have raised the price, the minimum price of tobacco in New York City to the highest in America, and we are making progress in reducing the number of people who smoke in New York City because of those local measures. That doesn't mean you can't go to another city or state and acquire those products more cheaply, but the lack of availability here has yielded some victories, as represented by the decline on that graph of young people who have started smoking. Where we're losing that war is in e-cigarettes, and we need to take action to prevent young people from suffering from a lifelong addiction, an addiction which you acknowledge is unhealthy. I do appreciate your perspective, and we are going to have to move on because we have this many people who still want to testify, and everyone's going to get a chance to speak. But I do thank you for speaking out, Dr. Abrams. Thank you. Yes, sir.
Mr. Chairman, council members, my name is John Conley. I'm currently an investigative support manager working as a contractor for Altria and Brand Integrity Investigations and Law Enforcement Support Unit. I supervise investigators that search for subjects counterfeiting cigarettes and/or smuggling cigarettes and tobacco products, and I train law enforcement in what to look for in relation to the smuggling activity. Previously, I worked for over 30 years in law enforcement, with the last 16 years at the New York State Tax and Finance Petroleum, Alcohol, Tobacco Bureau. Retired as the chief investigator of that unit and oversaw complex criminal investigations and undercover operations targeting subjects smuggling cigarettes, tobacco, alcohol, motor fuel into New York State to avoid the applicable taxes. I believe that banning the sale of flavored cigarettes in New York City will only increase the smuggling of illicit cigarettes into the city. In addition, banning the sale of flavored e-cigarettes and vape products will lead to an illicit market springing up to supply these products to consumers, and you will see the proliferation of subjects who will be offering them for sale illegally to retail stores or directly to consumers. Anytime an entity restricts a commodity or adds a tax on a commodity that is used by a large number of people, it opens the door for criminal groups to step in and take advantage of that situation. I've seen that previously in relation to numerous regulated commodities like cigarettes, tobacco, alcohol, motor fuel. Criminals are all about taking advantage of situations, whether it be selling a popular commodity at a lower price, such as cigarettes, or providing a commodity that is not readily obtainable through legal channels like synthetic marijuana, cannabinoid oils, or potentially flavored cigarettes, flavored e-cigarettes, or vape products. Once criminals have created a supply chain for an illegal commodity, they can smuggle all types of illegal products through that same network. These smuggling networks already exist in relation to cigarettes. Lower-priced cigarettes are smuggled in the New York City area from various sources and locations for resale, and this only will increase with a ban on the sale of flavored cigarettes. In addition, you will likely see the illicit smuggling of flavored e-cigarettes and vape products for sale into the city, if a ban is also enacted on those products as well. And I would say, even though we've heard from people talking about how much product does get in, whether people have stopped smoking or not, there are a lot of untaxed cigarettes already in the city, even though the regulations are there, and probably not enough law enforcement out there doing anything about it. So I think with the flavor ban, you're likely to increase the need for more law enforcement to be looking for those
And so,
products.
Mr. Connolly, by your logic, I assume you would favor removal of the ban on fruity flavored tobacco?
I'm not saying I'm in favor of anything. I'm just giving you the consequence of what happens, when bans and/or a tax or something goes into effect. That's what
Right,
you
but
have to deal with those issues.
I'm not a prohibitionist. I don't favor the prohibition of tobacco. I don't favor, at least until science would indicate otherwise, the prohibition of e-cigarettes. I favor doing everything we can as policymakers to keep them out of the hands of kids and to keep kids from falling into that addiction. And we have focused on the flavoring as a major driver of youth consumption. And I do want to emphasize, I'm sure you're aware, that nothing that we're considering today would outlaw the possession or the consumption of flavored e-cigarettes.
Right.
That it would rather outlaw the sale. And the truth is that you still can go on eBay and perhaps on Amazon and other sites and order those. Personally, I regret that, but that is the reality until there's federal action. But I do appreciate your perspective as a law enforcement officer. Thank you. Yes.
Mr. Chairman and members of the committee, thank you very much. Good afternoon. My name is Rich Marianos. I'm the retired assistant director with ATF, spending 27 years in law enforcement. I'm currently a professor at Georgetown University, teaching master's programs in applied intelligence. I'm here to discuss nuisance bans and nuisance ordinance because ban 1345, I feel is. I think it's a ban that is going to do many things. It's going to create crime, and it's also going to drive a wedge between law enforcement and the community, and I'll get to that later. Currently, New York has the worst criminal tobacco problem in America, and every year you lose in the illicit market about $1.63 billion to criminals exploiting the demand for contraband cigarettes. I enjoyed the testimony earlier of the sheriff and you working with them when you outlined that there's under 50 cartons of cigarettes, they're considered low level and misdemeanor. So when I did the data and looked at that, for a misdemeanor ticket, an individual can make $7.8 million for just a misdemeanor ticket by selling cigarettes, by going across New Jersey and bringing them here. $7.8 million would help these kids. $7.8 million would educate a lot of these schools that need some of this stuff for what you're talking about on the table. But let me continue. With 25% of the population, or the smoking population, involved in smoking menthol, if you were to maybe decrease this ban or get rid of this ban, I think it's going to alleviate a lot of problems you're going to have, and I promise you'll have them, between the police and the community. New York has the best police department on the planet, and they have great investigators, and they have the most resilient community you're going to find. They do some of the best work focusing on organized crime groups with cigarette smuggling, money launderers. They just took off a crew for $30 million. But even terrorists have found their way into this market. And if we continue to go along the path of allowing criminals to exploit this black market, you're going to find more bad guys involved in it. Finally, and I don't want to take up a lot of time because I respect everybody that's on that list, we have to understand that, you know, millions of dollars in the United States right now, and it was discussed for the last 4 years in this building, have been spent in trying to decrease this Ferguson effect, to make the police more accountable to the community and the community more accountable to the police department. Now you're going to place a menthol ban or a menthol restriction on the sale of tobacco products, which will get into the black market and drive a wedge with that community. You can't do that. You can't have both. Do you want a Missouri? Do you want a Baltimore? Do you want your citizens replying to the cops, don't you have anything better to work on? Because that's what you're going to have. And you know it well, Counselor. It's just the way of the world right now. And we want to try to avoid that. We want to work the community together, not against each other. Finally, when has public safety not been a part of a public health strategy? I hear all this talk about public health, and I agree, but public safety is paramount to public health. And if you're allowing criminals to make $7 million a year on organized crime and high-level targets, that better be a part of your public health strategy. I'm sorry, but it has to be taken into consideration. Finally, this city deserves respect to their men in blue and their community members. They deserve it. They need it. And by creating these senseless nuisance bans, instead of fighting crime and responding to calls for service, as during the last testimony, you heard siren upon siren, we need to take that into consideration instead of looking for nuisance abatement in turning our cops into code enforcement officers. I just ask you to respect that and respect your community and respect your men in blue. They deserve it. They're out there every day.
Thank you, Mr. Mariano. Thank you for coming up from D.C. We appreciate your testimony and the whole panel, and we are going to have to move on to hear our other voices, but thank you. And our next panel will consist of Brian Fotik, I'm sorry if I'm mispronouncing the name, from the National Association of Tobacco Outlets, Spike Babian from the New York State Vapor Association, Greg Conley from the American Vaping Association, Alex Clark from Consumer Advocates for Smoke-Free Alternatives, Jeff Steyer from the Consumer Choice Center, and Mark Kleiman from, I think it's called Botec. Okay. Would you like to kick us off, sir? Good afternoon. If you can, your mic.
Good afternoon, Chairman. My name is Gregory Conley, and I serve as the president of the American Vaping Association, a public health advocacy group which seeks sane and sensible regulation of vapor products with the end goal of getting as many smokers to quit as possible. In my limited time, earlier today we discussed cessation and the evidence for cessation and the evidence for flavors helping in cessation. Who is it out there that's talking about e-cigarettes being good for cessation? Public Health England, the Royal College of Physicians, our own FDA commissioner, Dr. Scott Gottlieb, recently stated, if all adult smokers switch to vaping, that would be a tremendous benefit to public health. Dr. Gottlieb himself, in explaining why he has not banned e-cigarette flavors, but is instead restricting them to adult-only stores, has repeatedly stated that there is evidence that flavors are helping smokers quit. For the general category, go look at the New England Journal of Medicine today at 5 p.m. There's an embargo. I can't tell you what the study says, but the idea of e-cigarettes not helping smokers quit doesn't match the science. My testimony that hopefully you have in front of you cites several studies, including an FDA-funded study that found adult users of flavored products were more likely to be smoke-free than those using tobacco flavors. That was my personal experience 8.5 years ago. Tobacco failed. I went back to smoking. It was only when I had melon that I quit. This is going to be prohibition. Today, I am in violation of this law, your proposed law. Your law says anyone in possession of 4 or more flavored products, that is the assumption that you are intending to sell them. In my bag today, I have more than 4 flavors. I could be arrested on the streets of New York City under your law because I am merely possessing products that I use when I am in this city. The failure to adequately defend the interests of adults who use e-cigarettes puts actual lives at risk. We can do this in a smart way. We do not need prohibition. Flavors are critical. You will hear from many adult consumers today. Please do not dismiss their stories as mere anecdotes, and I'd be happy to ask her any questions.
Well, we appreciate you speaking out. No one's perspective is being dismissed. I think you've probably heard that from me so far in the hearing. You're mistaken about the bill. There's no criminal there would be no criminal charges for possession of large amounts of product. It would be a fine. You would lose your license as a retailer ultimately, but to say you could be arrested is just not accurate.
So I could be fined for possessing 4 vapor products while walking through the streets of New York City?
For selling.
If you possess 4 or more products, that says they assume your intent. I would have to go to court and prove that those products were for personal use, or else I would face a fine. That is ridiculous. Every day of New York City, you have tourists coming here that bring along with them enough e-liquid to last them as long as their trip, enough cartridges. You are, if not criminalizing, giving them the ability to pay a fat fine for merely quitting smoking or trying to quit smoking. And all these vape shops that are here today, they will have 90 days to sell off all their inventory, break their lease, potentially declare bankruptcy, and get out of the city. That doesn't make sense when we have strong federal action coming, restricting these products to adult-only stores.
Okay. Thank you, Mr. Conley.
Thank you.
Please.
I think you want to use this mic.
Thank you. Good afternoon. I'm Jeff Steyer. I'm a senior fellow at the Consumer Choice Center as well as the Taxpayer Protection Alliance, but perhaps more importantly, I'm a constituent of yours on the north side of 96th Street, just within it. And I appreciate your very emotional and thoughtful support for helping end the problem of youth use of e-cigarettes, which is really the discussion here today, and I share that concern. But I would encourage you to consider a more targeted approach, one that will be effective and that one that will not harm adult smokers. We've heard a lot and we can debate the evidence, but flavors are critical. You mentioned earlier, oh, well, we should just have flavorless e-cigarettes. Dr. Abrams and others, and there's lots of science as well as lots of constituents who will testify, that flavors are critical to helping quit smoking completely. And I was embarrassed as a New York City resident, as a longtime public health advocate, that our health commissioner, who testified, maybe it was her first time today, didn't mention to you that there are 1 million adult smokers in New York, 1 million smokers. Why is that not also a concern? Why doesn't that trouble us? Why isn't that a crisis? If only we had something new that could help them, and we do. Why can't we come together? Why can't we agree that kids should not vape, that any store in New York City that is caught selling e-cigarettes to minors should immediately lose their license? And oh, it's only a small fine, maybe on the second time there's a bigger fine. Put them out of business and do so immediately, because they are the bad actors. But I would be embarrassed that if our city becomes the bad actor and makes it more difficult for smokers to quit using the flavors that they need to tremendously reduce the harm that they have from smoking. I think we can work together to find more targeted and more effective ways to protect kids, because we should agree that they should not vape and we should do what we can to help prevent that. But we can be tougher on the bad actors, and we should have some compassion for the adult smokers.
It's good to meet you, Mr. Steyer. If you ever need a pothole fixed on 96th Street, you can let me know. I appreciate the thoughtful nature of your comments. I do want to repeat that it's just inaccurate to say the city doesn't care about the 1 million smokers. And I gave a partial list of some of the aggressive actions that we've taken to try and curtail smoking by adults and others. It's a very, very long list. It includes banning smoking in almost all indoor public spaces. It now includes banning smoking in public parks. We've banned smoking in public housing developments. We have funding for smoking cessation programs that are available to all smokers in the city. We have raised the price of a pack of cigarettes. We're reducing the number of outlets where cigarettes can be sold. We are all in the battle against smoking, and we are going to continue that battle. But we've also got a parallel epidemic of 11-year-olds who are getting access to Cherry Crush flavored e-cigarettes, and we cannot ignore that.
I didn't say that the city doesn't care about smokers, but I do think we need to help those smokers, not by banning their access to flavors that help them quit. I think we can do both. I think a thoughtful way of doing it can accomplish both goals. And I think that's what we should focus on. Without, we've had hours and hours of testimony about how much of a problem it is that youth are smoking. We could have saved a lot of time, and we could have agreed upon that. It shouldn't be done. But at the same time, the health commissioner who is here did not talk about the adult smokers and didn't think about how we can do more, not to ban, not to marginalize, especially those, as Damon Jacobs so thoughtfully explained, communities that have already been facing a lot of challenges. But how can we help them, not ban, tax, and further marginalize them? I think that's where we can do better.
Okay, thank you. Yes, please, sir.
Good afternoon. Thanks for this opportunity to testify. My name is Mark Kleiman. My credentials, such as they are, and my financial interests are in the written statement in front of you. I've been working on drug policy for more than 30 years. And it's a little distressing to hear the drug war rhetoric, which has largely been abandoned with respect to the current illicit drugs, coming back to bite us on tobacco policy. I want to make 3 simple analytic points and 1 factual point. Vaping competes with smoking as a way of delivering nicotine, and it's a greatly reduced harm version of that. About 95% is the best estimate I've seen. In addition, the legitimate market in tobacco products competes with the illicit market in tobacco products. The proposal on the table, by disadvantaging licit vape sales, is going to relatively advantage both the combustion market and the illicit market. The factual point that hasn't been made yet today is that of the cigarettes consumed in New York City, 1/3 to 1/2 were not legally sold in New York City. That's approximately a $1 billion a year illicit market. That's comparable to the size of the illicit cannabis market or the illicit opioids market in New York City. And for reasons that have been discussed, we're not going to do much enforcement against that. We're not going to put bodega owners in prison. If we make flavored vape unavailable at vape shops, I have no reason to think that the very same convenience store owners who are now selling Virginia Marlboros under the table won't figure out how to sell vape pods under the table. And again, it's not as if we're going to enforce against that. So it seems to me that this very well-intentioned measure is likely to net increase mortality by decreasing the rate at which smokers switch to vaping. It's been emphasized that the FDA has not approved vaping as a smoking cessation device. That's partly because to get something approved by the FDA as a smoking cessation device, you have to prove that it won't appeal to non-smokers. So all of the products that are currently on the market were designed to be unpleasant to anybody who doesn't already have a nicotine addiction. That's the reason nicotine gum tastes so foul. That's a design feature if you want the FDA to approve it. Vaping products are designed as consumer products to appeal to people. And it turns out that they're much more appealing to smokers than the approved nicotine cessation devices. So it seems to me...
And if I may, sir, how many e-cigarette companies have applied for FDA approval?
No, nobody.
Why not?
No, because there's no way that a product that, as you've heard, appeals to juveniles is ever going to get through the FDA process. It's just a non-starter, not because it doesn't work for adults, but because they can't prove that it's unattractive to non-smokers. So that's a barrier. It doesn't mean it's not an effective device. It's just it can't get through that regulatory process. More generally, there's a double standard, and this is familiar to me from my drug war days. There's double standard of evidence. Any rumor that e-cigarettes do any harm is accepted as a basis for public policy. And evidence that they actually do good is dismissed as well. It's not conclusively enough done. That's I think, a mistake. I want to put two proposals on the table as alternatives.
If you can quickly, because
yes.
the hour is late and the stack is still very thick.
I understand. More aggressive enforcement against sales to minors seems to me is a perfectly plausible thing to do. And since the issue is primarily Juul, which is a very high nicotine product, if you want to do a product standard, put a cap on the nicotine level in vape. That, it seems to me, is the powerful way to go about this. I don't think that the flavor ban is going to get you where you want to go.
Okay.
Thanks very much.
Thank you.
My name is Spike Babayan. I have been here many, many times. I'm here today on behalf of New York State Vapor Association. We represent 700 shops in New York State and 70 of them specifically in New York City. There are 70 vape-specific shops in New York City that sell only vapor products. 93% of their sales are flavored e-liquid that is not tobacco. Because 93% of their sales make up flavored vapor products, without flavors, they will have no stores because you cannot pay rent with 7% of your sales. Unfortunately, this means the 70 shops in New York City will close. That also means that the people who come into New York City for work and for school and from Italy on holiday can no longer purchase vapor products. So many times since the age was raised, since I was here to fight the 18 to 21 raise, we've had young people come in from other countries and say, I need to buy some e-liquid, and we say, you're 19 years old, you can't buy that here, you need to be 21. Well, then I guess I'll just go buy cigarettes instead. And I understand that it's illegal for them to buy cigarettes at 21, but that doesn't stop them. It doesn't stop them from getting cigarettes. The guy who stands on the corner at Port Authority that opens his duffel bag and says Newports, Juul Pods, strawberry e-liquid, he doesn't check ID. We do. I have 4 shops in New York City. I opened the first vape store in New York City in 2011. Since that time, I have testified in front of this body of health committee and this New York City Council more than a dozen times to fight to be able to save lives. That's crazy. It's crazy that I have to spend, all 4 of my stores are closed today. All of my employees are sitting here. Those people that need to come in and buy their liquid to keep them off of cigarettes, they're buying cigarettes right now because my employees are here. My stores are all closed. Whose fault is that? I'm disgusted by the fact that I'm back here again to fight to save people. In the last 8 years in business, since 2011, I have saved over 10,000 people from smoking cigarettes. I have converted them to a product that is saving their lives, and in 90 days, you're going to undo that. I hope you can sleep with that.
You're learning the protocols. We appreciate that. Go ahead, sir.
Thank you, Mr. Chairman. My name is Brian Foydick. I testify today on behalf of the National Association of Tobacco Outlets. We oppose both proposals because they will cause harm to our retail business members in New York City, while also failing to achieve the policy objectives for which they're being offered. Regarding the ban on menthol cigarettes, there's no credible basis to demonstrate that menthol causes initiation or continued smoking. You've heard mentioned earlier about academic analysis of the illicit trade. It demonstrates that New York City is already the cigarette smuggling capital of the United States. If this proposal is enacted, menthol ban will only increase illegal sales and decrease compliance with age of purchase laws. Regarding the ban on flavored vapor products, once again, I would say there's no credible basis to demonstrate that flavored products cause initiation or continued use. Credible scientists in the United States and around the world, we heard briefly from one of them today, would demonstrate through science and evidence that these products are vastly safer than cigarettes. And I would say that if this flavor ban is enacted, the proposal will harm rather than benefit public health. Those who will be harmed disproportionately will be New Yorkers who are lesser educated and lower income, New Yorkers who struggle with mental illness or substance use disorders, and members of New York's LGBTQ community. Members of each of these groups smoke at rates much higher than the general population, in some cases 2 or 3 times the rate of the general population, and banning harm reduction products that can help those communities will reduce the quantity and quality of their lives. Government surveys demonstrate that youth get these products from social sources, and from 2000 until 2012, the youth smoking rates in New York declined approximately 1.25 percentage points per year. Since 2012, as vapor products became more prevalent, youth smoking declined about 2% per year and are lower today than at any time in recorded history. That is a good thing. Raising the age to 21 also eliminates the need to ban these products. It will only impact adults over the age of 21 trying to make legal purchases. For these reasons, we respectfully oppose both proposals. Thank you.
Thank you, sir, and thank you to this panel. We very much appreciate your testimony. We're going to try and keep this moving. Next up, we have Dana de Blasio from the National Supermarket Association, Jim Calvin from the New York Association of Convenience Stores, Max Bookman from the New York City Newsstand Operators, David Diaz W. Diaz from the Bodega Association of the United States. I think this is Mr. Mubarak from the Many American Merchants, and Victor Canestraro from Benevolent Liquids, Inc.
Ladies and gentlemen, if your name was called, please come up. If you have any copies of statements, have them ready when you come up. Thank you.
Please, sir.
Thank you, Mr. Chairman.
Thank you.
As you said, my name is Vic Canestraro, and I am the owner of Benevolent E-Liquids. I'm also the owner of Perfection Vapes, a retail outlet. I'm also a member of the Vapor Technology Association, as well as the New York State Vapor Association. I flew here this morning from Buffalo, New York, when I heard of what was happening. I felt that it was very, very dangerous, this type of legislation, simply because 2 weeks ago, I lost 2 of my brothers, one day apart, to cancer. Lung cancer, another that cancer went throughout his whole body because they didn't operate in time. 2 years prior to that, I lost my father, 2 other brothers. I cannot tell you how painful it has been to watch my family members all die of cancer that is a direct result of their smoking. It has been brought up here multiple times, the Royal Academy of Physicians. and the studies that have been done, I do not understand for the life of me. I've got some ideas, but I still don't understand it. Why the information you claim is unavailable is not being presented to you. The information is there that supports flavors help people quit. I'm a perfect example of this. I quit smoking 10 years ago. I started trying to quit at the age of 19. Didn't happen till I was 35. I started smoking at the ripe age of 9 years old, my first cigarette. Apologize. The difference between yourself and myself is more than likely you've never smoked. You will never understand what it's like to be a smoker. You will never understand that as a 9-year-old, it was easier for me to get a pack of cigarettes than a bottle of soda. That's crazy to think about. And that has not changed in the 30 years, 35 years that have since passed. We can continue to create laws and legislation that protect or attempt to protect. And in all truth, as many have stated, markets open up and products will be delivered to young and old. They make comedies. South Park made a wonderful little comedy about this. Kindergarten kids. I mean, it's sickening to think about that, but it's the truth. It's just the way the world works. But the difference between you and I is you've never experienced smoking. When you smoke a cigarette, you first start off, you hate the taste. You can't stand it. It's disgusting. But you continue to do it because you're young. Nobody starts, very, very few people start smoking after the legal age to smoke. So you continue to smoke and bear through this horrible taste, this obnoxious smell, because you want to feel older. You want to feel cool. You want to be respected. Now, during this time, your taste buds actually start to disintegrate. You don't taste food anymore. You don't taste anything. When I quit smoking, I tasted ice cream. I swear to God, it was like the most incredible thing in my life. At the same time, when I first quit smoking, I went to a vaporizer and I wanted tobacco flavor. What's ironic is about 3-4 days after quitting, all of a sudden my sense of taste and smell started to return. That item that I was now tasting was repulsive. I needed something that would satisfy my craving, but taste good. The alternative is to go back to cigarettes, which will take away my sense of smell and take away my sense of taste. I can't expect you to understand it. You're an intelligent individual by choosing never to have started down the path that so many of us, unfortunately, have done. I beg of you to just consider the ramifications of what your agenda is doing and could do. There's a documentary, it's called A Billion Lives. A gentleman, Aaron Bieber, put this together. Get it, it's on Amazon. There's doctors, there's scientists. The studies are there for you. But you have to look. Don't just buy.
Thank you, Mr. Canestral, for coming down from all the way from Buffalo and braving the weather and for sharing your story. I am so sorry about the loss of your two siblings. That's got to be incredibly painful, and you certainly have my condolences. And I think ultimately you and I are motivated by the same thing, which is I'm thinking about the next 9-year-old who's out there. And the reality today is young people who start to smoke are mostly starting to smoke e-cigarettes. They're not starting to smoke traditional tobacco. Maybe if that was available to you when you were 9, that would have been your path as well. And so those of us who are thinking about the next generation of young people have to focus on e-cigarettes. I don't minimize the value of this as a smoking strategy for yourself and others, but I am just pointing out our paramount interest in protecting the next generation of kids.
If I may, just to finish up with this, I do agree with you. The only thing that we're missing is the fact that we know 1 out of 2 people that smoke cigarettes will die of a smoke-related cause. We cannot identify that. So granted, the spectacle of smoking or vaping, the imagery that it conveys to other children, the idea that they might be addicted to it. I will say this, we are the only industry, and I will assure you that the vast majority of the business owners in this room have no interest in big tobacco. We are not Juul. We are not Philip Morris. We are not R.J. Reynolds. We are mom and pops that found something that helped save lives. And many of us have experienced that loss, and is what has driven me to have this type of passion to fly through blizzards and be stuck here more than likely for the next 2 days before I can go home to give this type of testimony. And I thank you for your time. I truly thank you for the opportunity.
Thank you again for speaking and for coming from Buffalo. Please, sir. Just press your microphone button.
Yeah. Good afternoon. My name is David, the president of the Bodega Association of the United States. On behalf of the over 14,000 bodegas that the Bodega Association represents, I urge to reject the proposal to ban the menthol cigarette and banning the self-flavored e-cigarette. These proposals hurt our community disproportionately and will not solve the problem of underage access. The bodega community is committed to ensuring that minimum age law and age verification requirements are fully completed with. New York already has one of the highest rates of compliance with underage law in the country. Bodegas are important to underserved community. We operate in the most challenging economic environment in New York State. Government policy which raise costs like higher minimum wage requirements or limit our ability to sell legal products to adults like tobacco products impact us for more dramatically than other retailers. Retail tobacco sales already have heavily regulated by the federal and state and city government. New York City currently has among the most restricted to regulation tobacco in the country, and not coincidentally also the highest rate of cigarette smuggling in the country. Higher taxes, minimum pricing, and license restrictions have already led to the dramatic growth of cigarette smuggling in New York State. The hardest the city makes is for legal at checking compliant retail to sell tobacco products to adults. The largest the black market will get. These hurt retailers reduce tax revenue and also harm our young. We believe the proposal will result in lost revenue, lost jobs, and increased number of sales underage and illegal selling. New York State has almost the highest tobacco taxes in the country. As a result, our state also has the higher rate of black market cigarette sales in the United States. Almost 60% of tobacco sales are not taxed or age verified. The black market is higher in the communities that bodegas serve. When sales shift away from the legitimate retail community, bodega feels like hardest. We have employees to pay and family to feed like everyone else. The Bodega Association of the United States respectfully requests that the proposal to ban menthol cigarette and flavored e-cigarette rejected. Thank you.
Okay. Le agradecemos que haya venido a certificar hoy. I'd like to ask a follow-up question if you'd like, we can translate.
Yes.
¿Usted prefiere inglés o español, como quiera?
Español.
Ok. Yo no sé si usted estuvo presente cuando testificaron unos muchachos que contaron de muchos casos de poder ir a una bodega de su vecindario y fácil de niños de 12 años conseguir cigarrillo electrónico de sabores. ¿Qué usted dice acerca de ese tema, ese problema? I'll translate to English in a moment. What I was asking Mr. Diaz is his response to young people reporting the ease with which they, as underage people, have bought flavored e-cigarettes from convenience stores.
Yo puedo decir lo siguiente. Hasta ahora yo no he recibido un solo ticket ni un fine para vender a un menor. Puedo decir que el 97 o 100% de las bodegas que pertenecen a nuestra asociación respetan la ley. Muchas de las personas, muchos de los pequeños negocios que venden los cigarrillos a menores no tienen licencia. Y nosotros resultamos con el problema. A nosotros es donde vienen las autoridades a darnos los tickets y a ponernos pruebas.
Mr. Diaz was explaining that he's personally not been ticketed or fined for this at his store, and that he believes the people who are selling to kids are unlicensed, which is an interesting angle we would like to certainly explore with the city, to specifically target unlicensed sellers of this product. We do have to move on, but very much appreciate. Una vez más le agradezco que haya venido a testificar.
Thank you very much.
Okay, thank you, sir. Please.
Hi, my name is Yusef Mubaraz from the Yemeni American Merchants Association. We're a nonprofit birthed from the successful bodega strike of 2017, and I'm pleased to provide testimony on behalf of our merchants against this bill. Yemeni American bodegas account for thousands of businesses throughout the New York area, a large portion of which these businesses in these neighborhoods, the Yemeni American merchant has their families and homes as well. These businesses support their livelihood, and a ban on menthol cigarettes or e-flavored cigarettes will inevitably result in a steep decrease in revenue for these businesses. Our community has particularly worked very hard to educate and raise the lives of our constituents to a comfortable standard of living by following the law when it comes to properly selling these products in their stores. So it's unfair to punish the law-abiding citizens by assuming the actions of the few. The idea of banning menthol cigarettes, which if you ask the average bodega owner is essentially banning cigarette sales entirely, shuts down a full faction of business. Such measures increase criminal enterprises of illegal sales, increases loosey sales, and in turn increases public safety needs for already stressed communities that these merchants and families are living in. Our law-abiding bodega owners will essentially be forced to either close their business or sell loosies to keep their business afloat, the latter of which we all know is not an option. We believe this bill needs to be fully reevaluated, if not abandoned completely. Our Yemeni bodega owners are a staple in our communities and the NYC economy, and we support our merchants by protesting this bill. We continue every day to educate our merchants on their responsibility to sell these products legally. I implore you to test this notion that you can easily buy products without age verification. We ask for a careful consideration of our community, and we invite you to work with us.
Thank you very much, Mr. Mubaraz, if I'm pronouncing that correct.
Yes.
I couldn't live without my corner bodega, and to me they're an essential part of the fabric of New York City neighborhood life. I'll ask you the same question I asked Mr. Diaz, which is how you respond to reports from young people who spoke earlier of the ease with which underage New Yorkers can purchase flavored e-cigarettes.
I mean, like I said, I would test that notion, and I do agree that the people who are selling these products to minors are unlicensed. I mean, their bodegas are, getting by to just support their family. They're not living high, wealthy lives. They wouldn't risk that by selling cigarettes or banned products to minors. The people with licenses take it very seriously. I myself can't even buy one without being ID'd. So, I reject that notion.
Okay. Thank you for speaking out and for your input and for representing this important sector in the city. And it's an opinion that matters a lot to me and the council as a whole as we think about this policy. Thank you all very much. Muchísimas gracias. Oh, yes, sir, please. Okay, you confused me.
Chairman Levine, my name is Jim Calvin. I'm the president of the New York Association of Convenience Stores. We're a private statewide trade association. Most of our members are licensed to responsibly sell legal tobacco products to adult customers. We believe that legislatively banning the sale of menthol cigarettes would be like commanding the tide to stop coming in. There's enormous demand for the product, about a third of total cigarette consumption nationally, and it's existed for generations. Menthol smokers would be undeterred in finding alternate sources of the product. It's widely known that hundreds of thousands of New York City smokers routinely buy cigarettes from trunk slammers, street peddlers, criminal entrepreneurs who smuggle them in, largely from lower tax states, down the I-95 corridor. The Mackinac Center for Public Policy describes New York as a smuggler's paradise, documenting that 56% of all cigarettes are purchased outside of regulated channels. As for flavored cigarettes, they too, if you were to ban them, would still be abundantly accessible in New York City, online, from neighboring jurisdictions, and from a black market which would become as strong as the one that exists today for cigarettes. Given the pervasiveness of these unregulated channels, the choice here is not between making menthol cigarettes available or unavailable, or between making flavored e-cigarettes available or unavailable. It's between having them sold in a licensed, taxed, age-verified environment, or having them sold on the street without any tax collection or age verification whatsoever. Please don't hand the other 44% of New York's tobacco trade to the bootleggers. And please don't unwittingly drive smokers of menthol cigarettes and users of flavored e-cigarettes to the unlicensed, unregulated, untaxed side of the street. Please don't cripple mom and pop retailers for whom business survival is a daily struggle and who are trying to do the right thing. When you asked earlier about the incidence of underage sales of tobacco in New York City, the administration representatives were unable to come up with data on their fingertips. However, I've got some data to share with you. New York State Health Department publishes an annual report of underage sales, community by community. The most recent report is for the year ended March 31st of 2016. First, let me take you back to 2006. At that time, in New York City, there was 85% compliance, meaning 15% of the time the retail store failed the undercover tobacco sting. In 2016, the compliance rate is now 94%. So retailers have gotten the message, and they're doing their best to do the right thing to prevent underage sales. As citizens, as parents, and as responsible business owners, we are as committed to preventing underage sales of e-cigarettes and tobacco products in New York City.
Okay. Thank you again for that perspective and for coming here and for representing your important sector. We appreciate that. Very quickly, Vic, because we do have...
I appreciate just one
yes.
thing, and to this point, and I really don't get the opportunity to talk to the bodega owners and the convenience store owners, but hearing their testimony, you said something that was key earlier, and I verified it. Amazon does now have e-cigarettes. What's ironic is it's against their very own end-user licensing agreement, eBay as well. This should be legislation that you guys could look at, because I got to tell you, a lot of kids are buying this stuff online. They're telling mom and dad they're getting a video game. It shows up on the credit card as eBay or Amazon, and they're getting stuff delivered right to the house before mom and dad even get home from work. But just thought I'd bring that to your attention.
Appreciate that clarification. Thank you. Okay. The next panel, we actually have 8 people who signed up from what looks like the same company called Harold Levison Associates. So rather than reading out all the names, if it's okay, I'll ask the individuals from that company. Okay, thank you for that. Thank you. Okay, then while you're settling in, was it Mr. Barone? Caron, I'm going to call up some additional individuals so that we keep this moving. So we have Alexander David Morales. We have Christine Johnson. I think it's Leonin Gindi, Mark Zilber, and Joseph Sinapi. And Mr. Caron, you can kick us off while we're waiting for the others to come up. Go ahead, sir.
Hi, my name is Robert Corona. I want to thank you very much for this opportunity. I'm here on behalf of Harold Levinson Associates, the ownership of. Firstly, I'd like to give you our background. HLA is a full-line convenience store distributor selling grocery, frozen, and refrigerated foods, beverage, school supplies, health and beauty products, general merchandise, as well as cigarettes and e-cigarettes. Our company is located in Farmingdale, New York. HLA is one of the largest privately held companies in New York State. Over the last 41 years, we have grown to over 15,000 customers, which includes thousands of customers within New York City and the 5 boroughs. We occupy 23 acres of real estate and have over 700 employees, most of them who are members of the Teamsters Union, and most live and vote within the city of New York. In addition to all this, we are also one of the largest tax collectors, not only in the city of New York, but the entire state of New York, proudly remitting hundreds of millions of dollars annually in support of the state that enables us to employ so many individuals and touch many lives in a positive way. This background is necessary for you to understand that you realize, that we're just not a fly-by-night company or individual wanting our voice heard, or we as an organization are not only worried about revenue. Cigarette smoking and teen vaping is an issue that all of us are concerned about as parents and citizens. However, this problem certainly did not arise overnight, and neither should decisions about the best way to address it. Yet legislation is proposing a ban on flavored cigarettes and menthol cigarettes without any notice or request for input from the very businesses that are licensed to responsibly sell these products to adults. This could be considered a careless misuse of authority with a potentially detrimental cause and effect result. Banning the sale of menthol cigarettes from New York City will lead to thousands of New York employees losing their jobs, many of which are union employees with health benefits and pensions. $100 million in lost tax revenue to the city of New York, tax collectors going into bankruptcy. The state and city won't have anyone to stamp cigarettes. The city will encounter hundreds, if not thousands, of people selling menthol cigarettes from lower tax jurisdictions. Crime will be out of control. In a perfect world, this would be a public health issue. However, we all know that we do not live in a perfect world, and therefore it is a business and societal issue, a serious issue that needs to be handled with care, thought, and responsible action. The marketplace has changed in just the last several weeks, with manufacturers voluntarily withdrawing some flavored e-cigarettes from the market. As you're aware of what the FDA is doing with regard to flavored products. The tobacco industry is working diligently with the federal government. We ask you to be patient while the federal government comes out with new legislation for all states. Respectfully, we think you need to call a timeout so that you can hear the effective retailers, wholesalers, and the community as a whole and investigate whether a sales ban would actually keep the product away from children and take the time to better understand all the regulatory and market forces at play here. The ownership of HLA is available to discuss the subject at hand and answer any questions at any time.
I appreciate that, Mr. Cronin. What % of your sales would you say are flavored e-cigarettes? You have a very wide product line, right?
Yes, we do. We have a very wide product line. I don't have accurate data on that, but being the regional sales manager of the city, of the 5 boroughs of New York City, I would say it's maybe 40% would be flavored.
40% of the e-cigarettes you sell.
E-cigarettes would be flavored.
But e-cigarettes as a whole and are only a tiny percentage. You said you sell all sorts of consumer products, packaged foods, et cetera, right?
Yes.
So the
tobacco and menthol, I would think at this point in my region would be the predominant sell each month.
Really, more than all the other categories combined?
Correct.
Okay. We have a lot of work to do to educate New Yorkers about health choices, if that's the case. But we appreciate you speaking out. Please, sir.
Hi.
Sorry, that mic actually is a little bit funky, so you can use either one.
Thank you.
Hi, my name is Alexander de Morales. I am 41 years old. I was a former 2-pack-a-day smoker for 21 years until 4 years ago when I walked into a vape shop in Manhattan and bought my first flavored liquid for a vape, and weeks later, I was no longer smoking cigarettes. Let everything come full circle, and I now work for that vape shop, helping others quitting smoking. In my family, there is a history of heavy smoking usage. There is a history of cancer in my family. I am that risk, but my risk now has been reduced because flavored e-liquids help me get off of combustible cigarettes. I am now also able to breathe better. I have lived most of my life with bronchial asthma. I have not had a fit of bronchitis in 4 years. I can actually run for my subway train and not be winded when I make it. And trust me, I live far, okay? Making this ban is honestly not going to work. You can ban a lot of things and it'll work, but there's a lot more things that don't work. I live in public housing, and let me tell you something, the smoking ban in public housing, not working. It's not working at all. But if you ban these flavored liquids, I will become not a positive statistic of somebody who no longer smokes. I will now be back in the statistic of a smoker, in risk of heart disease, in risk of cancer, in risk of just having bad lungs in general. I will also be unemployed because I work at a vape shop. And because, like with most of my customers, about 95% of them say that they will be going back to cigarettes if they don't have the flavors, and me living in public housing, I would also be at risk of losing my apartment because of this addiction, which is very hard. You may not understand how bad it is trying to quit smoking, but at least getting nicotine from something other than cigarettes, trust me, it helps a lot. I've recently helped my girlfriend make the switch. She was a pack and a half day smoker. I bought her a vape with some fruit flavored e-juice about 2 weeks ago. She's now down to half a pack. That's almost a whole pack a day less she's smoking now. Banning in general is honestly not gonna work because if we don't find other means of getting it as easy as just going down to a local vape shop, we're gonna either go back to smoking or just get it from somewhere else. It's as simple as that. I'm in agreement. Keep the kids away from it. There are so many other ways you could do to eliminate their access to it. But you can't just jump the gun and just ban it and risk having millions of New Yorkers go back to cigarettes.
Thank you, Mr. Morales, for speaking out, and I congratulate you on what I know must have been a very difficult process to give up tobacco. And I wish more people had the fortitude to do it. I congratulate you on that, and I hear you. I hear you on the role that vaping has played in helping you make that transition. And so we're glad you spoke out, and I appreciate you putting your voice on the record. Thank you to you both. We're going to move on to the next, because we still have a lot of people. The next panel will be Jonathan Corker, Robert Testagrossa. Oh boy. This is someone else from Cloud Vapors, but I'm Cloud 99 Vapors. Vale Zenzar, the handwriting is not readable. Looks like we have a second person with the last name Corker, also from Cloud 99. Matthew Elliott. And I think it might be Hamdan Hassan. Okay, I'm going to call two more, but then you can start, sir.
Sure.
We're going to ask for Robert Singhapi and Mariam Sunni. But you can start, sir, please.
Chairman Levine, good afternoon. My name is Robert Testagrossa. I am the president and owner of Cloud 99 Vapes. It's a local New York City vape shop. On behalf of our company, I'd like to express why we believe this legislation is counterproductive, overreaching, and ill-advised. I myself, as well as my partner, many of our employees, and thousands of our customers have quit smoking cigarettes through the use of flavored nicotine. I had no success quitting with nicotine gum or patches, and anecdotally we find most of our customers did not. On the one hand, our state is in the process of legalizing marijuana, a long overdue, widely supported change in law, that defers judgment to responsible adults. And yet, on the other hand, we're here today now debating banning the sale of flavored nicotine. This dissonance is a result of succumbing to a moral panic. Every responsible party in this industry is endeavoring to keep nicotine products away from minors. At our own stores, we go far beyond the letter of the law. No one under 21 is permitted entry. Every single customer is verified by photo ID before purchase, regardless of their age. And twice a month at each of our locations, a secret shopper is sent in to test that employees are following these written policies, a service we pay for at our own expense. We are responsible retailers, and our vigilance is not unique in this industry. We have 18 employees that depend on us for their jobs to pay for college, childcare, and to afford to live in a city that we call our home. There are almost 3,000 other licensed electronic cigarette dealers in New York City. These businesses, often small businesses, employ tens of thousands of New Yorkers. If this ban is enacted, the livelihood of every one of them will be endangered. Not one of us here wants kids to pick up these products, and we're 100% in favor of age restrictions and a robust enforcement of the law. But the concern that children will use them, the fear that is driving this legislation, is not a novel threat. Society has crossed this bridge before with alcohol. We do not ban flavored alcohol just because the underage find it palatable. Instead, we restrict the purchase to legal adults, and we prosecute any businesses or individual that violate society's norms and sells to children. This is exactly the tack that needs to be taken with e-cigarettes. I implore the City Council to follow the precedent that our society has established and not rush to repeat prohibitionist mistakes.
Thank you, Mr. Testagrossa, for speaking out and for your very thoughtful and respectful tone. You've got a lot of fans in the room, clearly. I will just point out on the charge of inconsistence vis-a-vis marijuana, for your own benefit and for the benefit of a few libertarians who are clearly watching us online and tweeting at me, I actually want the same thing for marijuana as I want for alcohol, as I want for tobacco, as I want for e-cigarettes. I want heavy regulation. I want heavy taxation. I want to strictly prescribe where the products can be sold and who they can be sold to. And yes, I do favor a ban on certain varieties of all of these products.
Are you in favor of banning flavored alcohols?
I might be if you can make the case, but I haven't seen any evidence that that's driving a youth epidemic of high school age alcohol consumption.
Consuming, blackberry schnapps or an appletini or something when you were underage? Don't you suspect that those appeal?
If you can make the case that those flavored liquors are driving youth alcoholism, I'd love to have that discussion. We can come back for another hearing. But in the case of vaping, we don't need to come back because we do already know that young people are vaping at epidemic levels, and they're overwhelmingly choosing things like Fantasy and Bazooka, which, if these aren't designed to appeal to kids, I don't know what are. I don't want to linger this. I do want to say how much I appreciate the case that you and others have made on 2 points. One is that there are adults for whom the flavor has been key to kicking the cigarette habit. I hear you on that. And I also understand that there are small businesses out there who would be impacted by this. So I don't minimize that perspective, and I want you to know that I hear you. And your tone was thoughtful and reasonable, and so I don't take anything away from it. But I just did want to respond on the questions of inconsistency among different addictive substances. I do want to move on only because it's now, we were supposed to be done at 5, and we have many other people who want to speak, and so yes, sir, please take it away.
Hello, Mr. Chairman. My name is Pete Cocker. I'm Rob's partner at Cloud 99. I'm a former smoker. I'm a shop owner. Unfortunately, my mom is currently diagnosed with stage 4 lung cancer. But today's testimony, I wasn't going to speak until I heard that young lady speak before about the prohibition and what we have not learned. So my past, I'm a retired New York City police officer, right? And the reason why I was compelled to come up here, the name that yourself and everyone else is dancing around is Eric Gardner. Eric Gardner died because of prohibition and high taxes, prohibition through high taxes. He was selling Lucy's in front of another bodega. And that's what I fear what's going to happen. You know, we could talk past it. As far as the e-liquid goes, I mean, the only people that sell Juul pods online is Juul themselves. So you're going to ban our stores from selling Juul, but they're going to be able to bring them into our stores. One of the largest ports in the country is right across the Hudson River, of an 8-minute ferry ride. You're going to create such a black market, and I guess it must be very easy, and not to be controversial with you, but I don't know if you've ever put handcuffs on people, but I did for marijuana, and there was a lot of people who were suffering from that. Now you're just creating that whole nother market, and it's gonna, I mean, believe me, nicotine is a lot more addicting, and people are gonna do a lot more shady things, if you want to say it, to get their nicotine fix than they ever did for marijuana. That I could promise you. So I heard people talking past the name because no one wanted to say it, but we've already had a young black man die because of high taxes on cigarettes, and now you're creating this other black market that I promise you it's going to happen.
And we care about the law enforcement angle, and I appreciate your perspective on that. Thank you. Yes, sir.
Good afternoon.
If you could turn your mic on, yep.
Good afternoon, or should I say good evening at this point. My name is Matthew Elliott. I am 27 years old, turning 28, and I started smoking cigarettes at 8 years old. I was stealing cigarettes from my grandfather's packs. I was stealing cigarettes from my mom's packs. Now, it wasn't from them not keeping them out of harm's way. I would look for them, inquisitive minds. But I started smoking full cigarettes, inhaling, at 8 years old. By the time I was 12 years old, I was smoking a pack a day. I've had nicotine going through my system since I was 8 years old. By the time I was 16, I had a slight disagreement with my mother, and I was out on the streets. There were many times I had to choose between, do I buy cigarettes or do I buy food? And I can't tell you how many times that I actually chose food, because I could always trade cigarettes to get food. I quit smoking using vaping when I was 22 years old, and at that point, I was a 3-pack a day habit. Cigarettes are expensive. I was working extra hard to afford it. Since then, I worked in the vape industry. I worked at shops, I work at e-liquid manufacturing facilities. I know the ins and outs of this industry. I'm also from Suffolk County, Long Island, but I lived in Carroll Gardens, Brooklyn for a time, PS 58. It is imperative that flavors are around to help adult smokers quit, because you've never smoked. Good for you. I have, and the thing that will drive me back is if flavors are no longer around. I was addicted, and I still am addicted to nicotine, but that's okay. I've made my peace with it. Others may not be able to, so I urge this health committee, listen to the testimonies of everyone, and if anything stands out, it is that a gentleman at 8 years old started smoking cigarettes, had to give up a baseball career because I was throwing up blood after practice. I chose cigarettes over food when I was homeless. Now, I'm able to help others quit cigarettes using flavored vapor products. Flavors save lives. Thank you.
Thank you, Matthew. Thank you for speaking. Yes, ma'am.
Good afternoon. My name is Miriam Sunny. I'm a minority, I'm a woman, I'm a lifelong New Yorker, and I'm a user of flavored e-liquids. I'm also the owner of a vape retail space in Queens, New York. We are an employer within our community and a holder of a license issued by this city to sell electronic cigarettes, which we receive by adhering to all the laws and regulations of this city, which include the refusal of any person under the age of 21 from even being entertained within our space. Approximately 95% of the e-liquids sold in our store are of flavors other than tobacco, and that's not because we don't offer multiple tobacco options as a part of our inventory. The thousands of adults that have quit the proven deadly effects of cigarettes, that have walked through my store doors, have done so because of flavors. Excuse me. Vape shops are not like one-stop smoke shops. We don't carry traditional tobacco products. And like others, my vape shop, we put a tremendous effort to self-regulate through employee and consumer education and should not be forced to go out of business because of sales to minors by gas stations, delis, and other similar, less concerned retailers that have not gone through the process of licensing or regulation. And we welcome further regulation by both the government and parental guardians, regulations that would serve both of our efforts of ending youth access to these products. We share the same goal and hope it's understood that our umbrella ban of all vapor flavored products is not going to be the best course of action. This bill needs to be edited in a way that would make sense for everyone involved. I will end by reiterating that my identity is that of a minority, that of a female business owner, and operating in a predominantly minority neighborhood in New York City, one that has not benefited from the previous smoke-free actions taken in a way that it may have benefited other parts of our city. I opened my business 4 years ago in order to provide my community with an alternative to cigarettes and the debts that follow from cigarette addiction, and I hope that we can continue to do so. Thank you.
Thank you for your testimony. Thank you to this panel. We very much appreciate it. And we're going to try and keep moving because we still have a lot of people. Next, I'd like to call up Ashley Zanata, Alan Schneiderman. I think it's David Mofrig, Stuart Bowers, Shara Wynn, it's Alex, I think, Kubara. And I'm going to call up a couple additional, but then I'll ask you to start. So we have Courtney Williams, Steve Maurer, and looks like it's Miguel de Jesus. You can start, please.
Thank you, and good evening, and thank you so much for the opportunity to speak. My name is Ashley Zanata, and I am currently the Community Engagement Manager of Tobacco Free Staten Island, a program that works with youth and the community to decrease the social norm and acceptability of tobacco use through advocacy and education. Eliminating flavors, including menthol products and flavors in e-cigarettes, can save lives and money. Flavored tobacco products are marketed in ways that appeal strongly to children and youth. These flavors are particularly enticing to young people, and experimentation can lead to long-term addiction to tobacco products. In addition, these products harm low-income communities, resulting in a greater burden and a less prosperous community in already vulnerable areas. Over the past decade, I have seen firsthand the rise of e-cigarettes and flavored tobacco products among youth, specifically 13 to 18 years old. I have been called upon by middle and high school principals to educate staff and students that these products have become so problematic within schools and communities. While we can all agree that kids should not vape, the reality is that due to the flavors and accessibility of these products, they are. A Truth Initiative survey found that in 2018, 1 in 5 high school students reported using e-cigarettes in the past month. Most people are here because it impacts their wallet. And while some can argue e-cigarettes help current smokers, e-cigarette use among high school students between 2014 and 2018 increased 160%. So the real question should be, are we here to help people quit smoking using evidence-based practices, or are we here ensuring that we sustain future users through flavors? Because through the testimony, what I'm hearing is that individuals have only replaced the products. I work with students, so I'm going to read a few of their statements. E-cigarette companies advertise with colors and diverse smells, and I feel like they target me by making it candy-like. I like mint and winter fresh, and the candy ones smell nice. Some of the ads make me feel like it's better for your health, but we really don't know that. Their marketing is used to get me during a bad time because it's colorful and tasty, but in reality, it will only make things worse. And there is so much we don't know about the effects. They are taking our futures away for money. Khalil, 15 years old. I see lots of signs advertising new flavors, such as mint, blue ice, bubblegum, and many more. A lot of these are specifically nearby schools, giving me, along with other students, easy access to get them. Isabella, she's 12. In order for e-cigarette companies to draw many of my friends in to buy or use their products, they make bright, colorful advertisements, signs that make us want this. They also advertise flavors to draw us in that make us want to use these products. Lastly, they make their products smell like sweet flavors that youth would like to try. The prime objective of public health law is to pursue the highest possible level of physical and mental health in the population to identify, prevent, and eliminate risks to health in the population consistent with the values of social justice. This is an opportunity to decrease the gaps of health equity and save lives of our future leaders, politicians, doctors, lawyers, and advocates. So while New York City has come a great, great way, there is clearly more work that needs to be done, especially in regards to flavors.
Thank you, and thank you for sharing the voices of young people. It's always the most important. Thank you. Yes, sir.
This one, right?
Yeah, that one does.
I think they actually fixed the funky one, too, if you want to
No, that's all right.
give it a shot.
Hi, my name is Alan Schneiderman. I'm 24 years old. I've been smoke-free for 4 years now because of flavored nicotine products. As a former smoker of 9 years, I can confidently say that if I had been stuck using a tobacco or menthol flavor, I would still be a smoker today. I'm completely opposed to minors using vaping products, but I'm also completely opposed to not allowing adult smokers the chance to get off traditional cigarettes they've been a slave to for years. I have 3 younger siblings, aging from 14 to 17, and not a single one of them or their friends smoke cigarettes compared to when I was their age and all my friends smoked. You say you care about children's health, and I really hope you do, but between losing sin tax money, master settlement agreement payments, going to legalizing recreational marijuana, including flavored, candy, THC-infused products, it seems more about economical issues in children's health. Why not regulate these products by enacting mandatory ID scanning, we-card training programs, heftier fines for non-compliant retailers, and why are we not fining the minors who have these products? In 45 out of 50 states, if a minor gets caught with an e-cigarette product, they get fined, they get sentenced to community service. That gets the parents involved. Why are we not doing that in New York? Another problem is we should really let the adults know that if they try to purchase a product for a minor, that they are going to be charged and fined as well. It's not just the retailer, because there's a huge problem with adults buying it for minors knowingly. And it's a shame that because of them and their problems, not just them, but because of those issues, we're all going to suffer as consumers. I'd like to ask you, do you drink coffee? And if you do you drink it black, or do you put sweetener in it? Why is it that adults put flavors in their coffee? They don't like the taste of it by itself. Basically what you're saying is the equivalent to, we can only drink black coffee with caffeine in it, and if we want coffee that has caffeine in it, we cannot have it with sugar, we cannot have it with creamer, because children also like flavored creamer and sugar. It's not fair for these adults that are going to lose out on these products. Thank you for your time.
Appreciate it. For the record, I don't put sugar in my coffee. Also, no one's dying from coffee. Go ahead.
My name is Stuart Bowers. I run an electronic cigarette store in Brooklyn. Part of my job and responsibility is to make sure that underage do not purchase from my store. But parents also have a job and a responsibility. Mrs. Furman's son bought an e-cig on eBay probably for about $70. Pods go for about $25. I'm not in her home to tell her child that he can't buy those things. If I don't do my job, I get fined. When a parent doesn't do their job, what happens to them? There's no fine there for them, there's no consequences for the youth. If your son throws a rock through your neighbor's window, you don't punish your neighbor's child. You're not going to get the results you're looking for. This bill holds no responsibility for a parent not doing their job or hold a child accountable for his actions. Instead, you want to punish me and my business and my customers, make me pay for the broken window. In Park Ridge, Illinois, they have made it illegal for underage to possess vaping products. There's a fine to be paid. Consequences for your decisions. When parents start having to be responsible for their child and pay fines, watch how fast this epidemic disappears. All of a sudden, parenting will be coming into the factor, not flavors. Flavors are an important part of my business. My oldest customer is 86 years old, and he uses a mango-flavored e-liquid. If this bill passes, you want me to tell him that he can't get his mango liquid because some kid thinks it's a good idea to use a Juul. It's cool for him and his friends. The New York City and New York State health commissioners have, to my knowledge, not met with any vape businesses, vapors, or organizations like the New York State Vapor Association to get information from the people who use the product. This is a regulation that impacts us, yet you don't have us in the mix. We're never on the other side of the table when you're talking to the American Lung Association and everybody else. I would like to see some kind of information from somebody that's going to give me some kind of guarantee that if these flavors are taken away, that underage youth use of these things will drop. The consequences to this bill passing will be my business will close. I will be looking for work. My customers will be purchasing flavored liquid from outside of New York City and maybe New York State. Some of these guys are going to go back to smoking if they don't have access to these products. All of these consequences affect everyone else except the parents and the children who are using these products not meant for them. Me having to look for a job, my business closing, potential for my customers to go back to smoking have no effect on the underage users. Why you're punishing me for something I did not do is beyond me. I am not in your house. I'm not the boogeyman hiding in the closet that pops out to tell your child not to vape. That is a parent's job. Why is my choice of flavors and my choice to use these products being threatened because of someone else's actions? And I'm just going to have a quick disagreement with you that if you think that tobacco is going to work for everybody, the analogy to that would be telling somebody that who's in AA that they can only drink beer-flavored liquid from a can. These people are using these products to stay away from tobacco. If they use a product that tastes like tobacco, it reminds them of smoking. I didn't understand that in the beginning. I use tobacco all the time. I have 33 flavors in my store. My oldest customer is 86. My average age is probably 30 to 40 years old. This is an important thing, but you have to make the people that are responsible for this take care of it. If you want to deal with the marketing, I see no problem with that. If you don't like cartoons on the labels, deal with it. You cannot sit there and tell me that a flavor that is attractive to a child is not attractive to adults. That doesn't make any sense here. Or because it's glow-in-the-dark red. If your kid is not supposed to have it, you teach your kid not to vape. Thank you.
Thank you. Thank you. Hi.
Hello. I didn't know I was going to speak, so I didn't have anything written out, but I think it's just that e-cigarettes have been proven to be a lot safer than smoking, and even though I'm not a smoker myself, because of e-cigarettes and e-cigarette flavors, that stopped my husband from smoking, that stopped my father-in-law from smoking, and so many friends that I have in this room. And if we know that they're a much safer alternative, I don't see why you would want to limit that access to people, because all of us have been affected by people we care about. Smoking has killed them, and I think a lot of lives are at stake. Thank you.
All right. Not bad for not having notes. Thank you for speaking, and thank you to this panel. Next up, we have I think it's Yavor Kirilov, Maria Kolesnikova, Avinash Ramkumar, Cheryl Richter, Dan Donahue, Joel Morgan, John Abraham. And we're going to continue to call names. Jill Welsh, Kim Ermelanch. Okay, thank you. Thomas Snyder, Jordan Tiniello, I think it's Shakana Blake, Robert Watkins, Ricardo Garcia. Okay. Ma'am, since we're not sure which one you are, if you would please give us your name.
Hi, I'm
as well.
Cheryl Richter. I'm the Executive Director of the New York State Vapor Association, and there's a couple of things that I wanted to bring to your attention. You had mentioned or asked the question, what about the governor's bill? We actually provided, our association provided suggestions for curbing teen use to write into the bill, which we were very happy to see quite a bit of that in there, including better control of fake IDs with scanners at point of sale, stricter penalties for those caught selling to minors. A lot of people talked about that today. We believe in some sort of point system where you get a certain number of points, you're out. And in New York City, that's very strict. But if it's not something that gets checked on and not something that people can lose their license over, I don't believe that there's the fear there. Certainly there is at a vape shop, because that's like 100% of their business. Mandatory training for all employees selling vapor products regardless of where they're selling them. So that's in the budget bill. Marketing restrictions at C-stores, keeping signage out of sight of if minors can come into the store, and also age restricting vape shops to keep minors from entering them. We have also suggested age verifying software for online sales and a separate vapor license from tobacco, because our regulations that would be included in here are stricter than what's already on the books for tobacco. Banning flavors are going to give an unfair advantage to big tobacco when people don't have a choice of a safer, more appealing option. I also want to make a point that New York State Vapor Association takes absolutely no funding whatsoever from big tobacco or any big, large corporation such as Big Pharma or anything. We are strictly the mom and pop, independent, 700 vape shops. Market's roughly the same size of the number of McDonald's that are in the state.
And the number in New York City is 70, is that right?
That's licensed independent vape shops, yeah.
As opposed to?
As opposed to grocery stores, C-stores,
Understood.
gas stations, et cetera.
Understood. Okay. Thank you for speaking and for waiting to this late in the afternoon. And sir, if you could give us your name, because we don't know who's who with all the names I called.
Hello. Is it working? All right.
It is working.
All right. My name is Robert Watkins. I'm a vapor and I work at a vape store. I'm 26 years old. I started vaping in 2012. I went from 2 packs a day. I actually quit based on the flavor. Once again, just like a whole bunch of other people, I started with the tobacco, didn't like it, kept smoking cigarettes. Once I started all these different flavors, then started enjoying it more and was able to effectively quit smoking. I have no interest in smoking again. And it seems to me that the only 2 reasons to be going after the sale of flavors is either parents not wanting to parent their kids and wanting to use the power of the state to do their parenting for them, or somebody's getting funded by big tobacco. That's the only 2 options I'm seeing, at least from my point of view. And I'm kind of like Thomas Jefferson. who said he'd rather deal with the problems of having too much freedom than too little of it. So that's me. Yeah.
Okay, thank you.
Hey, so I gotta press this. Hello? Okay, apparently it's on. My name is Ricardo Garcia. I am 37 years old and I've been vaping for 6 years. The reason why I quit was because I was actually helping my brother because he was having my niece have a child. It was very hard in the beginning. I did attempt with tobacco, but I also failed. I too work in a vape shop. Plenty of customers come in who are over the age of 21 and actually ask for flavors, and raspberry, blueberry. And I have customers just like the other gentleman in the back who are like 50, 60 years old who are doing mango and blueberry and all types of stuff like that. And for me, you know, I like helping people. And the fact that I could do that is a plus, you know. And for myself, I feel better. I'm a little overweight, but you know. But all in all, banning vape flavors, in my opinion, would kind of set us back. I do agree that there should be regulation. I do agree that there should not be cartoons and that type of stuff. So I understand where you're coming from, but I think banning it altogether wouldn't be like a great idea.
Thank you. Thank you for your sincerity and for speaking out. Yeah. And thanks to this panel. And this is going to conclude our hearing. I do want to thank everybody who spoke on all sides of this issue. One of the most informative hearings I've ever had the chance to chair. And just so you know, everyone's comments are... one more? Okay. I'll continue to offer my rousing closing statement while he makes his way up. But I do want you to know that while it might feel like the chamber is somewhat empty now, everything you've said is going to be transcribed. Your words will be available on our website, and the video, in addition to being live streamed now, is available archived. So it does matter when you speak out, and we're glad you came. And sir, please, you'll close us out.
Okay. My name is Daniel Morris.
Did you fill out a witness slip?
I did. I have a feeling that I was the David with the unpronounceable last name because I have really terrible handwriting.
What is your last name?
Daniel Morris.
Okay.
And I live in Brooklyn, New York, and that was written on the slip.
Okay, no problem.
All right.
You said your name is Daniel Morris?
Daniel Morris.
Okay.
Yes. I never smoked. I know people who did smoke. One of my closest friends in the world was a long-term smoker. She managed to finally quit after trying gum and patches and everything with an e-cigarette. And she hasn't smoked since then. I now work for her after losing my job when Radio Shack went bankrupt a few years ago in an e-cigarette shop. And the bottom line is that I don't work with the customers very much. I do office work. I sometimes help out with inventory and that sort of thing, so I'm exposed to the customers. And the majority of the customers don't do tobacco. And if you told them to do tobacco, they'd say, why? So I don't understand the ban on flavors. I know that the company that I work for doesn't sell to minors. They don't even let minors in the store. And that's probably the best environment to see e-cigarettes sold in. And since I started working, and I'm one of those people who researches stuff rather consistently, I've seen studies that people don't seem to be talking about that say that e-cigarettes are less harmful than regular cigarettes. And it seems common sense. You're not inhaling something that's been on fire, so it would have to be less harmful. You know, I'm sitting there on my phone, and there was a study that was published in the New England Journal of Medicine today. The study found that smokers that were given e-cigarettes and told to choose their own flavor are twice as likely to quit smoking as those who were just even given regular nicotine replacement therapy. And that seems to be an argument towards e-cigarettes as a cessation device. Whether the FDA has approved any e-cigarettes as cessation devices? No, of course. They haven't approved anything since the August 8th deadline for new products. And that's not the fault of the companies that are making the e-cigarettes. I don't see that as being an issue, and I don't see why banning flavors would be helpful at all to people trying to quit smoking. Thank you.
Thank you, Daniel. Thank you to everyone who testified today. And this concludes our hearing.